Your meeting is now live, Chair.
Thank you. Good afternoon, everybody, and members of the public. Welcome to the Health Overview and Scrutiny panel meeting this afternoon. I'm Councillor David Fuller, and I'm the chair of this meeting this afternoon. Welcome to this meeting, which is being held virtually in response to the limitations placed on governance by the COVID-19 pandemic. The City Solicitor advised that this meeting will be run by reference to the model standing orders as set out at the local authorities governance coronavirus. This is the local authority meeting regulations number 2020 and number 392. The meeting is being broadcast to enable the press and the public to view it. Those present are requested to keep their microphones on mute and only turn them on when you are called to speak, please, members. Members are requested to keep their cameras turned on at all times. Officers are requested to turn their cameras on only when they are presenting their reports or answering any questions. If any members would like to speak, if they could use the chat facility, which is and just put RTS, and that means request to speak, in the chat function. It makes life much easier for me rather than putting one's hand up. So now I'm going to invite everyone to introduce themselves. Those that are not here will be confirmed at present and will be recorded as absent from this meeting if they shouldn't be here. So the first councillor I'd like to invite to welcome is Councillor Lee Mason. No? Okay, we'll move on. Councillor Leo, there we are, Lee Mason. Okay, Lee Mason's going to join us in a few seconds. Councillor Leo Madden, please. Would you like to introduce yourself?
Sorry, you're breaking up. Sorry.
Sorry.
Is Councillor Leo Madden present?
Thank you very much, Councillor, and welcome. Councillor Steve Weems, please. No. Councillor Tom Wood, please. No. I'm going back to Councillor Lee Mason. Welcome, Councillor. Would you like to introduce yourself?
Hi, I'm Councillor Lee Mason, Caution Ward. Apologies for getting in slightly late. I had trouble with my dongle.
Happens to us all, Councillor. Welcome.
Yes.
Councillor Vivian Archwell, please.
Yes, good afternoon. I'm present and I'm representing Winchester City Council.
Thank you, Councillor, and a big welcome to you too. Councillor Arthur Argate, please. Councillor Argate? No? Okay. I'll move on then. Councillor David Keast, please.
Councillor David Keast, representing Hampshire County Council.
Thank you, David, and welcome, Councillor. Councillor Philip Raphael, please.
Good afternoon, Chair. I'm Philip Raffelli. I'm Gosport Borough Council representative. Thank you.
Thank you very much, Councillor Raphael. Sorry if I say it wrongly. Do apologise. Councillor Rosie Rains, please.
Good afternoon, Councillor Rosie Rains, Havant Borough Council. Thank you.
Welcome. I've got a smiling face at the top there. Is it Arthur Argate? Councillor Argate?
Yeah, Arthur Argate.
Arthur, welcome.
Good afternoon, Chairman.
Thank
Members.
you very much.
Pleasure to see you as always. And you, Rosie. Always good for a laugh.
Good, thank you. We had a couple of councillors that wasn't here at the moment. Who's the main councillor? Councillor Steve Weems. Is he present yet? No. And no. Okay then. So I'd also like to introduce a Councillor Carl Corkery, who's here to do a deputation later on. Councillor Corkery, would you like to introduce yourself?
Good afternoon, everyone. Cal Corkery, one of the councillors for Charles Dickens Ward on Portsmouth City Council. I'm here to give a deputation on agenda item number 6, the closure of the Guildhall Walk Healthcare Centre.
Thank you very much, Councillor. And Councillor Claire Udy, who's with us this afternoon, I'm sure she'd like to introduce herself. She's here, she wants to observe what's going on. So, Councillor Udy, welcome. Would you like to introduce yourself?
Hello there, I'm Councillor Claire Udy, part of Charles Dickens Ward in Portsmouth, and I'm here to observe mainly around agenda item number 6 as well. Thanks.
Thank you, Councillor Udy. I hope you have a nice afternoon. And helping me with all this is Jane De Niro, who's the local Democratic officer. Jane, would you like to introduce yourself?
Yes, Chair, I'm the local democracy officer. Thank you.
Yeah, democracy. Okay, so welcome everybody. And so the first thing is I've had apologies and absence. So Councillor Cartwright has sent his apologies for absence, and Councillor Graham Heaney has sent his apologies. He'll be arriving here, please God, just after 3 o'clock. So we're expecting Councillor Heaney just after 3 o'clock, members. Okay, members. So now we'll move on to any declaration of interest at all. Members, have anybody got any declarations of any interest at all? Would they like to use the chat facility if they have? No, I don't think they have. Sorry, yes. Councillor Leo Madden.
Chair, I can't use the chat facility. I'm sorry, it doesn't seem to work in this. So, and I want to speak on a few of the items today. So, and I can't find a way to put my hand up either. I'm used to these things, but is it all right if I intervene when the time comes?
Yes, of course, Councillor, and okay. I'll make sure I put you in there. That's certainly, Councillor. These things do happen, so that's not a problem at all. Thank you. So, members, any interest again, just to make sure that we've ticked the box and we've done that. Okay. Okay. So, minutes of the previous meetings held on the 21st of January. Members, I wasn't here. Councillor Lee Mason did that for us, and thank you very much to him. Members, you've all seen the minutes. Can somebody give me a proposal and seconder?
Yeah, I'll go down for that, Chairman.
Thank you very much. Councillor Argate has proposed it. And anybody want to second that? Councillor Lee Mason, I saw your hand up. Are you happy to second?
I'm happy to second that. Yeah.
Thank you very much, Councillor.
You're a bit quicker, Rosie.
So we recommend that the panel agree the minutes which are correct. Thank you very much. So matters arising at that meeting, the Sustainability and Transformation Partnership Keep Well cooperative document was published with the minutes. I think you've all got that. An update on the Sensibility of Transformation Partnerships Academy was requested at the January meeting, was sent to the panel on the 17th of March. Is that correct, members? Yeah?
Yeah.
Happy with that? Okay then. So now we're swiftly moving on to number 4 on my crib sheet, which is the Portsmouth Clinical Commission Group update. So, members, you have read the papers. So, Joe York would like to please introduce yourself, and if you could say if you'd like to add anything before we move to any questions. So, do you want to introduce yourself first, Joe? First of all.
Yeah, thank you, Councillor. My name's Joe York. I'm Deputy Chief Officer for Health and Care Portsmouth, and I'm here today deputising for Innes Richards, who's the Chief Officer for Health and Care Portsmouth. Nothing has changed since the publication of the report that we sent to you, dated 26th of February. So nothing to add, and very happy to take any questions you may have on the report.
Members, there we are. We've just heard from Joe York. Any members wish to add something? I'm looking at Councillor Madden quickly, first of all, in case his hand goes up. Yes, Councillor Madden.
Thank you. Thank you. Sorry, I'm two screens at the minute. Yeah, the one it's the white paper I'm interested in, which is Health and Care Portsmouth update. Joe, okay? And I'm not clear what's going to happen or what's intended to happen. At the minute, we sit outside the other local authorities in relation in the rest of Hampshire, including Southampton, and I also believe including the Isle of Wight. But it says here the Portsmouth and its functions will become part of the wider Hampshire and Isle of Wight ICS. Does that mean that we will then incorporate with the rest of the authorities?
So, the white paper that has been published is due to come into effect. They're aiming for the bill to go through the House, I think, in May or June this year, and for, assuming it receives smooth passage, to come into force from April 2022. And that means that the CCGs will cease to function, cease to exist, but the functions of the CCG will be merged into the ICS, the Integrated Care System, and that will become a statutory body that will take on the functions of the CCG. Now, currently in Hampshire and the Isle of Wight, we already have an ICS, an Integrated Care System, that operates across all of Hampshire, and we are all part of that. For Health and Care Portsmouth, both the CCG and the Portsmouth City Council have signed up and are part of working to that. What this means is that partnership working will become more formalised. But what is also really important in the white paper, when you read through it, is that delegation of responsibility to place. And place for us, I think, in Hampshire and the Isle of Wight is very clear. We have Portsmouth, and place is defined as being around the boundaries of local authorities. So for Hampshire and the Isle of Wight, as you say, Portsmouth, Southampton, the Isle of Wight and Hampshire. We also know that we need to continue to work at those boundaries, and to think about how we can delegate responsibility from the ICS in the future to those place areas. But also, as we've already do, it's also really important to work across hospital boundaries. So for us in Portsmouth, we work very closely, as you know, with Portsmouth and South East Hampshire, and so our partners who will become from April the Hampshire, Southampton and Isle of Wight CCG. So I think for us in Portsmouth, we will continue to be a CCG for this year until the legislation makes changes. The CCG has recognised that this was a direction of travel and that we need to work at all of those levels. CCG has delegated responsibility of some of its commissioning functions to the Chief Executive of Portsmouth City Council, so that we can continue that Health and Care Portsmouth integration. We will also have, our expectation is we will have a shared accountable officer with the Hampshire, Isle of Wight and Southampton CCG from the 1st of April, and that accountable officer will also be the accountable officer for the whole Hampshire and Isle of Wight ICS. So we hope that in the city and working with our partners outside those boundaries, we will be able to work over the next year to ensure that we have that strong place-based delegation that will enable us to continue to work in the way we have for Health and Care Portsmouth and maximise on that, but that also will be better placed to continue to work through the ICP in Portsmouth and South East Hampshire, and that broader footprint of the Hampshire and Isle of Wight, and that we're able to get the economies of scale from that. So I think it's very much the direction of travel that we've been going on. We will have to wait and see.
Thank you, Jo. Councillor Madden, did you want to add something else to that?
No, I think I'll just wait and see developments.
Yeah, that's what we need to do until the legislation comes into force, I think. But I think we're well placed to influence locally and work at all of those levels as it makes sense to.
Yeah, thank you, Chair.
It looks like he's frozen.
I think the chair's frozen.
Yeah. He has.
Yes.
I think he's.
Looks like he's. I think the vice chair. Lower. Welcome, Lee.
That's what happens when you chair too many meetings.
I think I'll be trying to get back
in that case, can I call I think Councillor Raffaelli, you've got a question to ask as well, haven't you?
Yeah, thanks, Lee. Yeah, really, it's building on what Lee Madden was asking about. As it happened, I was at the Hampshire County Council Health and Wellbeing Board today, and the whole of the ICS and the ways ahead was part of the same discussion. And it's quite clear yeah, and in keeping with what Joe was saying about the ICS are going to become a statutory body. But one thing they were quite clear in that presentation about is that they will take on the financial commissioning role of the CCGs. It was also clear that actually across the wider Hampshire, there's already been a slight schism's maybe too strong a word, but Frimley ICS is set up and it's charging on its own. And one of the members of that board from a local authority was describing herself as being like a polar bear on two separating icebergs. They may well be travelling in the same direction, but they are diverging at the same time, which was a real concern for her and how she could work cross-partnership. And I do have just a slight nervousness that until we get the governance arrangements for the ICS arrangements, which I think could be another 4 to 6 weeks, unless Joe's heard more, then it's just not crystal clear to me how the rest of the Hampshire Isle of Wight ICS, which will become the commissioning body for the current Portsmouth and South East Hants CCGs, because they'll cease to have that role in a year's time, how we're in danger setting up two slightly parallels. Now, I get the sense of place thing, but that's below the ICS level. And clearly, Gosport has a fundamental interest in this because our neighbourhood, to use a term that seems to go in and out with the NHS, certainly centres round the shared Portsmouth Hospitals Trust's District General Hospital. So we're really keen to see everything work communally and for all voices to be heard. That's the first question, so really statement I'd like Joe to comment on. But a separate one is I do also notice that in the setting up of this interrelationship with Portsmouth City Council, you've, for example, taken into that arrangement the Chief Finance Officer, who, of course, is partly hired by Gosport Borough Council, as it happens. And I just wonder what his role is going to be in this new arrangement, particularly if in a year's time commissioning is going to go to the Hampshire Isle of Wight ICS. Thank you, Chair.
I think it is difficult, isn't it? Because we are talking about a white paper that isn't yet in legislation. But what is very clear from the legislation is, as you say, that the commissioning functions from the CCGs will sit formally in the ICS, that the ICS will be the statutory body. But what is also very clear is the recognition that there should be a strong ability to delegate to place, and that should include some of the resources. So I think for us in Portsmouth, what has always been really strong is our integration across health and care, and where we have been able to have joint roles and bring the money together to have pooled fund arrangements through the Better Care Fund, through continuing healthcare commissioning. We have seen real benefits, I think, in that approach for the residents of Portsmouth, and both this, we have all partners, all health and care partners in the city have committed to continuing that approach, and the integration across health and care is absolutely fundamental in the white paper. So I don't think any of us in Hampshire and the Isle of Wight would want to see a backpedaling of that. And
I'm sorry, can I come in? We're drifting away really from the point. Portsmouth, and you're continually on about Portsmouth, has isolated itself from the rest of the surrounding it, and I'm South East Hampshire. Haven't Gosport and the rest of it. For some unknown reason, Portsmouth is the only one who's not joining in with the rest of the establishment. Why? I understand why, because Portsmouth Corporation have tried to integrate everything within the council, but that's all right for Portsmouth. But of course, it leaves the rest of us, for want of a better word, we're out in the cold. Why? We know why, but I still don't understand the reasoning behind it.
Joe, could you answer that? Sorry, I was a little bit of the computer threw me out, but I'm back in there.
Yeah.
Just Councillor, if I just remind you to use the chat facility if you can, rather than your hands, it makes life much easier. Joe, would you like to answer that, please?
Yeah. So I don't think Portsmouth has we haven't wanted to isolate ourselves. That's absolutely not been our intention. What we have been very clear in the city is the need to work together across health and care boundaries, but that absolutely we need to, and we do work across the boundary of the hospital footprint with our partners in South East Hampshire and Fareham and Gosport and Hampshire County Council. And I think it is going to be a more complex environment, perhaps, as we move forward. I think all local authority boundaries within the ICS will want to retain that close working arrangements at a local level, be that Hampshire, Southampton and the Isle of Wight. But we all recognise also that we need to work on those other footprints as well. For us, that's absolutely Portsmouth and South East Hampshire. And we work really hard, all partners working with the Hospitals Trust, to make sure that we don't have a postcode lottery, that we have that consistency of approach across health and care. And similarly at Hampshire and the Isle of Wight perspective as well. But again, it is how the four local authorities as well as NHS partners can come together and work at that levels as well. And I think we all want to do that where it makes sense to do so. I just wanted to pick up on Councillor Raffaelli's point as well that I didn't manage to get to, was the Chief Finance Officer in the Health and Care Portsmouth arrangements refers to the CCG Chief Finance Officer being under that umbrella of Health and Care Portsmouth. Chris Ward will still sit with pure council responsibilities.
Thank you. Councillor Philip Raphael, was that answer your question that you've just put in there? Anything you wanted to add, sir?
Yes, thanks, Chair. The second part was crystal clear. Thanks for that, Joe. I still think the tension that's going to be there, we're not going to resolve it today. I think we won't know till the governance arrangements are out, and indeed a year later for full implementation. It just doesn't make sense to me, however, if we're going to try to affect economies of scale by giving the new ICS statutory body the commissioning function for other previous CCGs as they will become in due course, retaining some commissioning capability. That's an expensive part of the business to run, whilst clearly to reflect sense of place, they need input into what commissioning is undertaken. If that's simply then delegated, to my mind, that runs counter to the whole thrust of the ICS. But we won't resolve that today. I think it's just something to bear in mind. In a year's time, we'll see. A lot depends on who runs ICS and how well they do it, I suspect. But thank you for that, Joe.
I think, am I able to just...
Yes, of course, Joe. I was going to come to you. Yes.
Because I think it's really important that we don't leave here today thinking that the ICS means a one-size-fits-all solution for everybody, and not everything can or should be done at scale. Some of what works and what we know works from the way we all work together across health and care has to be done at that very local level, supporting our primary care practices, GP practices, PCNs and primary care networks, and you know the communities. So that is really important. It's really important that we retain those neighbourhood links, the place links. For us, that's the city, but the boundaries across Portsmouth and South East Hampshire, that you have that consistency as well. But also saying, absolutely, there are some things we can just do once across Hampshire and the Isle of Wight and get those economies of scale for that. So we're going to have to work at all levels to make sure that we don't lose what we've currently got now with local CCGs, but that we can absolutely embrace working at scale as well. So that's my hope that we can get to for the future.
Thank you very much, Joe. Councillor Argate, did you want to add anything at all? Are you happy for us to carry on, sir?
No, please carry on.
Okay. Councillor Leo Madden, I know you had problems with your chat. You're happy for me to carry on? Fine. Lovely. Okay. Any other members want to ask any particular questions to Joe on that before we move on to number 5? No? Okay, members. So we move on to number 5, which is the Portsmouth Hospitals NHS University Trust. Members would have read the papers, so Penny Emirate and John Knighton, would you please introduce yourself and say if you'd like to add anything before we move on to members' questions. Over to you, sir.
Good afternoon. I'm Penny Emmerich. I'm Deputy Chief Exec at Portsmouth Hospitals. Once John's introduced himself, I will just add a couple of comments before we go to questions, just to update for the latest information.
Thank you very much for that. John.
Thank you very much. Good afternoon, everybody. And I'm John Knight, the Medical Director at Portsmouth Hospitals NHS Trust. Thank you.
Over to you then, Penny. Thank you very much, and welcome both of you, I must say. Welcome.
Thank you very much. So I just wanted to update a couple of the numbers in the paper since it was written, because obviously these are moving daily. So just a couple of key facts for you in terms of the prevalence that we're now seeing in Portsmouth. It continues to decline, and today the rate of infection is 44 cases per 100,000, and that's broadly in line with the England average now. However, we are continuing to care for more than 100 patients in our bed base. And I think just to remind you of some of the conversations we've had here before, I think that's reflective of the impact that we have felt in the Portsmouth and South East Hampshire patch as compared to other parts of Hampshire and Isle of Wight. So prevalence rates in this part of the county and the city as well rose earlier and faster than in other parts of Hampshire and Isle of Wight. And as a result, we saw higher numbers of inpatients, both in our general bed base and in critical care, than in other parts of Hampshire and the Isle of Wight. So I just wanted to share those additional updates so you've got a sense of where we are today before we go into questions.
Yes, please, Penny. Thank you. Okay. Okay, I'll carry on, I think, Penny, while it looks... Yeah.
That's fine, and nothing further to add before we go to questions. Thank you.
Thank you. Any questions, members, to Penny at all, or to John? We've got somebody. 1 second. We've got Councillor Philip Raphael. There we are. I've said it correctly. Councillor Raffaelli. Yes, Raffaelli. Yes.
Thank you for that report. It's very interesting, and the amount of pressure and effort from all yourselves and all your people is just remarkable and much appreciated. I've got a couple of things I wouldn't mind asking about. You mentioned a bit about staff welfare and the rest. It clearly must have been very, very difficult for all of your staff. Is there a more sort of concrete thing you could put? I mean, what's your sort of sickness absence rates? Do you have people who you feel might be leaving the service because of the pressures they've been under? And how are you coping with that? That would be the first thing. If I put all three together so we don't have to go back and forward. You also mentioned you're doing work for some of the staff who have declined vaccination. I'd be interested in what kind of numbers you're talking about. And in the longer term, it's not uncommon in the health care services to actually mandate vaccinations in some particular areas, surgeons with Hep B, etc. Have you begun to get your head around that for the future? And then the third point is you do talk about infection control, but you don't mention specifically COVID. We've had some horrific figures in the press about nosocomial infections of COVID. I've never seen anything sort of reflecting how much of an issue that has or hasn't been within PHT. That's the 3 points. Thank you, and thank you very much.
Thank you very much. Penny, would you like to answer that, or John? Penny?
Yeah, thank you, Councillor. If I start on the sickness absence, I'm sure John will want to come in to share what that experience has been like for our staff as well, because we have had to massively extend our services over different footprints and respond in a completely different way. So the demands that has placed on our staff, whether that be working in a different area or under significantly more pressure, absolutely must not be underestimated. So really important that our focus as an organisation has been on supporting our staff through that, but perhaps even more importantly, supporting our staff after that in anticipation of the demands that are going to come again in terms of recovering our position, but also in anticipation of there being future waves. So I think that's the really important context, and John can add more detail in terms of what that has looked like. To pick up your specific questions though, I guess around sickness absence and then retention. So when we first did kind of modelling in terms of how we might respond to the pandemic, we anticipated or kind of scenario planned for very high levels of sickness absence. But actually, through a number of measures, both availability of testing for our staff and also the infection control measures that we've put in place to protect our staff and patients, we have been able to manage our sickness absence rates, and at times we have controlled that very well. What I would say though about retention is I do think that's a very big concern for us in terms of how we plan future services. The challenges that you've just described must not be underestimated, and the impact that that has had on people. And as we come out of this this wave, I'm sure there are colleagues, and we know that there are colleagues who are thinking about what that might mean, whether that be bringing forward retirement plans or thinking about exploring different careers. So for us, that support that we wrap around our staff is hugely important to make sure that we are retaining and supporting the expertise that we have in our teams. But John, do you want to add some detail to that?
Yeah, thank you, if I may, and
Yes.
Councillor Raffaele, thank you for the question. And Penny's absolutely right. Beyond the numbers, the reality of the experience of managing 3 times the normal staffed funded capacity of intensive care, twice the staffed capacity of the respiratory high care where non-invasive ventilation is managed. Of course, those levels of demand were managed without any more staff who were trained in delivering that level of intensive support to patients, and so it was done by drafting in staff from other areas across the hospital at the same time as the general and acute beds were being filled with COVID patients, up to, as the paper describes, nearly 60% of all of our total bed base. And unlike in wave 1, the hospital was full to bursting throughout this period, whereas in wave 1 pretty much everything else stopped coming in for a period, and so we were down to levels of 50% occupancy. The net effect of all of that, beyond the numbers for the staff looking after those patients, was that it was a really trying experience, as you would imagine. We I think can be incredibly proud of our colleagues in the way they managed that at all different levels and right across the staff groups. There was a huge amount of flexibility and preparedness to contribute wherever and outside of people's normal roles, and a lot of mutual support, as well as the oversight from, again, at every level. But there is no doubt that there is a range of experience. You put 10 people in the same environment and there will be 10 entirely different experiences from that. For some people, they thrived on that experience, and for others, it was probably as close to being the worst thing they can imagine as possible, and were desperate to be able to move away from doing what was necessary. So it is really hard to quantify what the impact will be longer term on staff retention and people's plans around retirement or thinking. And there's no doubt people are talking about whether they would want to go through another wave, if another wave were to come, and increasingly we're led to believe that we need to prepare for that anyway. But I think we certainly have tried, and in reference to the other part of your question, we have tried really hard through as many different routes as possible and in many different ways to try and both hear the experience of staff, to be alongside them, and to ensure that the offers of support and the different ways of supporting our staff were the ones that would be useful, that they were asking for. And for example, to just sort of top that bit off, if you like, most recently we've commissioned an independent and anonymous survey of all of our staff, of which I think in the end about 3,000 staff completed it, which is essentially a confidential wellbeing survey. It gives each staff member who completes it a confidential report for them personally on holding the mirror up, if you like, to where they may feel, how they may feel, and what they might want to be able to do and think about that, but also captures at trust level, anonymously obviously, the feedback about what additional support or well-being offer people would find valuable and might help them in feeling more comfortable in work, very much aiming to both address the sense of wanting to be at work and feeling well at work and retain staff.
Councillor Raffaelli, do you want to come in again there, or are you happy with that explanation?
On the first part, I think it's a remarkably good job they're doing it, and they've obviously covered all the bases. So thank you for the first question. Thank you.
Thank you very much. Is there another part to that question? Sorry, yes, there is.
Yeah, there's two more parts.
Okay. Yeah,
Shall I come back on vaccination?
Yes, Penny. Yes, please.
Yeah. So if I do vaccination, and then John, do you want to pick up infection control? So the first thing to say on vaccination is that 100% of our staff have all been offered the opportunity to take up a COVID vaccination. 88% of our staff have now taken up that opportunity for a first dose vaccination, and we are now in the process of administering all of the second doses. So 88% uptake. You reference the work that we're doing to try to increase that further still, because of course we need to get that as high as we possibly can. And so there's a couple of things that we've done additionally to the normal offers and support and encouragement of staff to take that offer up, including trying to understand what particular concerns might be driving our staff not to take up that vaccination. There's a couple of areas that we've worked with. So we've worked with our obstetricians, where we've heard that there's concerns around pregnancy or other related issues. And we've also worked with our ethnic minority staff to make sure that we're supporting them to take up that offer as well. So there's two examples of what we're doing to try to further increase that uptake rate.
Thank you, Penny. John, do you want to come in on the next
Sorry, on
one?
the vaccination, the other part was that in the longer term, do you see this being a requirement of employment in certain areas in the hospital?
Can I take that one, Penny?
Yes, of course.
Yeah.
So it's a really good question. It is one that we've talked about a lot. In fact, we've talked about it in the last 2 or 3 years pre-COVID around flu vaccination as well, as you will probably recognise. It's something that, as a country, and it's been talked about in the fortnightly conversations with the chief medical officers through medical directors as well. There doesn't seem to be an appetite to make that a compulsory, a mandatory intervention, if you like. I absolutely recognise the example you cite around hepatitis B vaccination, and I can see that we may end up revisiting that possibly through a combination of professional and public pressure. Particularly, I think if we find ourselves in a situation as a country whereby a key element of protecting the public is or can be through herd immunity, through vaccination of healthcare staff. At the moment, though, the answer is no.
Thank you. And that segues nicely into the final point, is about how much nosocomial infection from COVID occurred in BHT.
Yeah. So nosocomial infection was and continues to be a big concern for all of us, particularly given for us the prevalence that there has been in the community and the level of COVID occupancy there's been in the hospital, because we know that those two things, which of course are related, but they are each independently very strongly associated with the likelihood of nosocomial COVID infection. So people becoming COVID positive in the hospital, and that has absolutely been the case. We know that, so nationally, well reported and described both by NHS England, but also in the Health Service Journal, that once you get to levels of COVID occupancy of the hospital beyond 20%, there is a steep and parallel rise in the rates of nosocomial infection. That is exactly what we've seen as well. And as the rates are coming down, we've seen the inpatient rates coming down. We're seeing the numbers of nosocomial cases coming down too. There are obviously, we've been taking every possible measure to protect patients and to prevent nosocomial infections. That started, we had very few, I should say, just to presage what I was going to say, we had very few nosocomial cases in the first wave. But of course, what we had then was a 50% empty hospital, so we could much more securely isolate almost every single case with COVID. This time round, running at 95% plus occupancy, what we've had to do, as in common with other organisations with similar pressures, is to cohort patients. And because of the numbers of people coming in, we've had to We've had to cohort them on best clinical index of suspicion, because we didn't have at the outset the rapid turnaround testing that would allow us to be much more confident or certain in the diagnosis of patients from the point at which they arrived at hospital. We now have that rapid turnaround testing in place, so that effectively every admission coming into the emergency department gets a high sensitivity test with an over 80% accuracy of detecting COVID, and therefore the ability to cohort them much more securely. So there are a number of compliance standards, if you like. Some more were added to the armamentarium at the end of October. We obviously are complying with all of those, and we've been taking a monthly infection prevention board assurance framework through our trust board to update and demonstrate our compliance with that. But on top of that, we've also, because it's something we've been so focused on across the organisation, we've also looked to support our infection prevention team with additional intelligence from a group of non-infection specialist senior clinicians to try and make sure that we were looking at every possible opportunity, in addition to the compliance actions, for reducing the risks, be they around different use of PPE, potentially even outside of or beyond what Public Health England recommends, be it around the adequacy of ventilation of the wards, and indeed the way in which we cohort patients and the pathways for admission and movement through the hospital.
Philip, did you want to ask anything, or are you happy with those 3 points?
Thank you, Chair. I'm happy. I just got one final point.
Yes,
at
please.
the peak, at the worst, what was the percentage of those that were positive in the hospital that were nosocomial? Because we've heard in some places that were up to 45%.
Yeah, it wasn't. No, we were. I think it's out. The exact number I might be slightly inaccurate, but it'll be very close. It was. I don't think it ever got beyond 25% at its absolute worst, which was and that was the absolute worst was the period middle of January to first or second week of February, a point within that. So the absolute peak occupancy was the second week of January, and that also correlates with the peak of our nosocomial cases. And I'm confident it didn't go beyond 25%, but I think it was around 23%.
Okay, that's very helpful. Thank you, Chair. Thank you.
Thank you very much. Thank you very much, Councillor. I've got 3 other people wanting to speak. The next person on my list is Councillor David Geest, please.
Keast.
Yes.
The 3 guesses, that's enough.
Yeah, that's okay.
First of all, I'd just like to quickly say how sad I am to see that Mark Huppin's moving on. I understand he's actually going in 5 days' time on a secondment for 2 years, and I think my own personal view is he's done a very, very, very good job in the time he's been there, trying to turn what is like a bit like a juggernaut round. So that was just a sort of a comment. Part of my question's already been answered, because I was going to raise the question of infection within the environment of QA, because I know there was quite a lot of infection going on across with people going in with a minor thing and coming out with, or staying in, I should say, with COVID. But my question, therefore, the second part was regarding the consultations. I noticed that some of the consultants are doing consultations still on the phone, while others are doing it actually on the premises. Is there no overall rule on this, or is it just left to each individual department on whether they do it on the phone or not?
Who would like to answer that, Penny or John?
I'll take that, if I may.
Yeah, okay, John.
As it's a clinical question.
Yes.
Yeah, no, thank you. So you're absolutely, the Councillor's absolutely right. There is quite a lot of variation. We've tried to, wherever possible, make sure that a virtual consultation, where it's good enough, whether that be in a minority of cases through a video or more likely through a telephone conversation, is the first and preferred option. What we learned in the first wave, though, was that for many specialties, or even within a specialty, for certain types of consultation, be it diagnosis or patient group, that didn't work as well as it needed to for some people. in the first wave, we all, across the NHS, we largely suspended face-to-face outpatient consultations. That was acceptable perhaps for a relatively short period. For what we knew would be the sustained duration that it has indeed proven to be through this winter, that wouldn't have been good enough for many specialties or types of consultation. And so we have asked specialties, consultants, services to make sure that they are offering the most appropriate sort of consultation, rather than a blanket rule as to what is the the mandated type, if you like.
Okay, David, do you want to come back on that at all? No,
that's fine. Thank you.
Thank you very much, David. The next one on my list.
Sorry, Chairman, could I just come in there with?
Yeah, I was just coming up to you, Councillor Argate. Now, just coming to you now.
Right,
You're next on my list, followed by Rosie.
In answer to, sorry, Rosie, you're on next, Gil. Just to make a point that my wife is an oncology patient, and a phone call has worked extremely well. A phone call from Dr. Archer's office the other day saying, it's been over a year, you better come in and I'll have a look at you, which I think was a very reasonable thing to do. My wife appreciated it, and she will be coming in and they will be having a chat, no doubt. This is usually bullied by my two daughters, so she doesn't get any option. She will be in to see Dr. Archer. Now, because my wife's an oncology patient, and because she's in there every 3 weeks, and her usual Wednesday appointment's been changed to a Saturday, not so much of a question, more as a recommendation that whatever staff you employ in there on a Saturday, give them a check sheet, because my wife went in on Saturday, and the young man, and there is an unusual start. Oncology, you go in through the steps down and through the side, and you're usually met by 1 or 2 nurses who spray you down and make sure you've washed your hands. And before you go into either the waiting area or the oncology, well, the young man who was in there on Saturday, when my wife gave him the flow test thing, which she had to do before she went in, asked her what he was supposed to do with that. And I thought, yeah, I'm coming. I've got a meeting today, so I can pass that bit of information on. And it was nice to be able to turn around and say, yes, they are doing face-to-face meetings. My wife appreciates it. The patient appreciates it. My daughters appreciate it. So thank you.
Thank you very much, Councillor there. I think duly noted, I would say, John and Penny. Yeah. Okay, Councillor Rains, then you're next to talk to or pop any questions or any comments to Penny or John. Councillor Rains, please. Rosie Rains.
Thank you both. Just to say that you've actually all done such an amazing job, and everybody is so grateful to what you've done. You've actually asked most of my questions, but the one thing I was wondering, post-COVID and long COVID, is there much support for the patients that have long COVID within the hospital or GP surgeries?
John, looks like a one for you.
Yeah, it is. Thank you very much. So yeah, a really good question, and the short answer is yes. Whether the slightly longer answer is that I think it's still going to need to be developed more. There is across Hampshire and the Isle of Wight, so our fledgling integrated care system, there is a small amount of funding that has gone into setting up a service across that footprint, and that obviously includes care and provision for Portsmouth patients. One of our special respiratory specialist consultants is our link into that service, and is obviously coordinating, making sure that our patients get the input they need. Beyond the strict definition or diagnosis of long COVID, there is also obviously a really significant need, and if we have a further wave, even more so for the rehab elements, the multifaceted rehab elements that don't necessarily just focus on patients who are diagnosed with long COVID, but patients who are coming out of the acute hospital with the immediate short-term consequences of a COVID diagnosis that's left them debilitated and weakened. So that is a real challenge, and I think it's one that is going to continue to need quite a bit of input and potentially additional focus and resourcing across a wider healthcare patch than just within Portsmouth as well.
Okay,
Lovely, thank you.
Thank you, Rosie. Did you want to come back on anything there, Rosie, that you've heard? Or are you happy for me to move?
No.
Thank you. I think
Very
that was
happy,
a
thank you.
move on. Thank you very much. Next person on the list, I've got Councillor Vivian Archwell. Vivian?
Yeah.
Over to you.
Just wanted to repeat what some of my colleagues have said about, the amazing job the staff have been doing under, obviously, tremendous pressure. I just wanted to ask, obviously, a year on now, what kind of lessons do you think have been learnt?
Interesting one. I think there might be one for you, Penny. Do you reckon?
Yeah, I'll start. I'm sure John will have things that he wants to add as well. I think the first thing to say is that we have all learned a huge amount, not only about COVID, but about how you respond, in an incident like that. And I think the ability of our staff to respond on a daily basis to changing guidance and to adapt their practice should not be underestimated. If you think about where we were at the beginning of this, with very, very well, at first no access to testing and then very limited access to testing, and now widespread, not only symptomatic but asymptomatic, the way that we have therefore had to practice to put that in place has been massively different. So that, just as a way of working, I think is a really important thing to acknowledge. And also that therefore what that has meant is that we have operated as an organisation in incident command for a very, very extended period of time, which is so different to how you would normally run an organisation. So there will be a period of readjustment for everybody to work out what are the right ways of working in the future, that, as I think you're indicating, take learning from what we have done and apply that to our normal business. So we've absolutely got to reflect on that, and it's taking the time to make sure we do those reflections. Some things I would probably draw out from that, because we did have a period of looking back on the first wave, and we're doing it now as well when we're thinking about recovery. So the clinical leadership that has been at the centre of this and will be at the centre of everything that we do going forward has been absolutely key, and it will be vital when we think about how we prioritise the resource that we have going forward to make sure that we are responding to any ongoing demands from COVID, but also every other type of service that we offer across the NHS. So that clinical leadership is absolutely key. There have also been examples of service transformation that we have been able to put in place at pace that possibly, without that absolute need to do so, we definitely wouldn't have done at the pace that we have, and might not have been as brave as we have been to put it in place. And so there is a piece to say, and what are those things that we would hold on to? So some really key examples around the approach that we've taken to urgent care. From previous conversations that we were a national pilot for the 111 first piece, which is now embedded in the way that we work as a system. And the benefit, I think, that has brought not only to our emergency department to try to make sure that we're getting the patients who truly need our care here. And of course, that's an ongoing process. There's more to do, and we need to work with the community and our patients to make sure that we continue to do that. There's that benefit, but also making sure that we're making best use of all of the services for urgent care in the community. So how do we direct people to the place that can help them, whether that be the pharmacy, their GP, an urgent treatment centre, rather than coming into the emergency department. So the way that we've delivered urgent care has been massively transformed. We've touched on another example already in the conversation, which would be about the way that we use virtual appointments. So how do we reduce the number of times that people have to travel to the hospital to get their care? And there's been some other really important things that we've been able to maintain despite dealing with a pandemic as well. So our cancer performance, we have maintained our cancer performance throughout this. So prioritising our resource to those really critical services, as well as dealing with the pandemic, has been really key. So those are probably my key reflections.
Thank you, Penny. John, did you want to add anything on that at all? Any reflection back at all?
I will keep it brief because it's something that is really close to my heart and I could talk about for quite some time, I think. But I think there are, you know, it's all too easy an analogy, and it's potentially disrespectful. So I won't draw it out. But you know, when describing a war situation, a conflict situation, innovation comes out of adversity, doesn't it? And there are lots of parallels. In fact, lots of our military staff have described those parallels in what they've experienced over the last few months. We've learned a huge amount, and I think we have captured a lot of that. Penny said a lot of the things, but my broad headlines would be people's flexibility and preparedness to think about doing things in a completely different way because of the necessity to do that. I really hope, and we're certainly talking about how we don't lose that. I think you can approach it in so many different ways. We all miss being able to have face-to-face interactions, but actually there are some real benefits for a bit like this, being able to get together virtually from wherever people are located. I now meet with my clinical service leads twice a week through this medium, and I get far more of them in attendance every single session where we can talk about all of the things that they really want to be able to engage with, and I need them to be able to ensure that the clinical leaders in the organisation understand and can contribute to what we're doing. I should probably stop, or I will keep going on for a long time. But I do think there are a lot of positives. We've learned a lot of lessons, and we're very focused on how we don't lose those as we rebuild the normal services.
And also, I think it's good to say that nobody knows everything all the time. So it's good to reflect back and learn by possibly, what we could do better next time. So that's great. Any other members then want to say anything before we move on to number 6 on the agenda, please? No. Okay, then. So number. Sorry. Yes.
Just raise one point.
Yes, of course.
There has been some fantastic developments, just as has been said by John and Penny, and we mustn't lose these. A little worm in the back of my mind says that we still have a requirement, however, if it's going to be a substantial change to service delivery, that it's shared with other partners such as this committee before implementing these changes. It's easiest to move away from medicine. We all saw some of the transport change options that Grant Shapps put in London. Some were brilliant, some were a complete and utter disaster, but all done with the best of intent. So please don't lose the lessons you've learned. But when it's going to be a substantial change, just a little bit of wider sharing before going nap on them. That was my only thing, Chairman. Thank you.
Thank you very much, Councillor. Okay then, members, so we'll move on to number 6, which is the Guildhall Walk Healthcare Centre. So before I ask Joe York to present this report, I will take this opportunity to inform members that on Tuesday just gone, the full Portsmouth Council resolved that the matter contained in the public question, which was number 2 to that question, and the question was, will the administration comment to opposing the closure of the Guildhall Walk GP surgery, and if necessary, pledged to work with the CCG, the Patient Participation Group and others to secure alternative provision as close as possible to the current surgery. And this was to be referred to us this afternoon for consideration. So that was a Tuesday's meeting, a full council meeting. As you know, the closure of Guildhall Walk Healthcare Centre was already on our agenda for discussion today. And I will ask members to consider that question that was put to full council on Tuesday. We also had a deputation on this item, has been submitted, which members received this morning. Jane did call me and ask, you know, would I give permission to read it out? And obviously, I said to her, yes, please, to read that out. So we're going to hear from that in a second. And also, we had a deputation on this item had been submitted from received this morning from Jane and from Councillor Carl Corkery, who would like to make a deputation as well. So, Jane, I think the first thing is, would you be able to read the deputation out first before we go over to Councillor Corkery?
Yes, certainly, Chair.
Thank you very
much. Just a moment. Okay, so it's a letter addressed to the panel.
Yes,
okay, please. So on the 3rd of February, we received a letter from the Primary Care Commissioning Committee that a decision had been taken not to renew the APMS contract with Guildhall Walk beyond its expiry date of the 30th of September 2021. I and PHL, with whom I am now working, strongly believe that the decision taken by the committee is fundamentally flawed for a number of reasons. I have been deeply immersed in primary care in Portsmouth for the last 12 years as the managing partner of the Portsdown Group practice until October 2020 and as a founding director of the Portsmouth Primary Care Alliance. I therefore have a deep and detailed understanding of primary care delivery in Portsmouth and of the variety of demographics present within the city. I also know from first-hand experience when Queen's Road surgery closed in similar circumstances the devastating effect that such a closure can have on the most vulnerable patients. So, number one, for the last 12 months at least, PHL have been discussing with the CCG options around a new contract and the location of the surgery. Options being considered included remaining in the existing building under a new lease or moving to Somerstown Health Centre, where the CCG has been paying rent on vacant space for the last 5 years. Neither of these options had, during our meetings, been dismissed. In fact, in a letter sent by Margaret Geary in her capacity as chair of the PCCG to us on the 30th of November, it was confirmed that the CCG would support PHL in its move to Somerstown Health Centre. It was therefore with considerable surprise that we received the news of the outcome of the committee meeting, particularly when subsequent statements and comms from the CCG cited issues relating to estates as the main rationale for the decision. Number two, Portsmouth City Council have made it very well known that they are strongly opposed to GP practice closures, publicly stating in January 2020 that they would seek to work with the CCG and GP practices to avoid future closures, particularly if the rationale behind the decision related to estates. In a letter to the CCG sent on the 1st of March, we asked the CCG whether the council was duly consulted prior to the committee decision being made. We have yet to receive an answer to this question. 3. In Portsmouth and indeed nationally, GP practices were already under considerable, sustained and well-documented pressure, even before the pandemic. The last 12 months under COVID have subsequently proved even more challenging. However, this may be as nothing compared with the tsunami of demand which is predicted to hit primary care and the health system when we are through the worst of the pandemic. Nationally, health leaders are already planning for a flu epidemic next winter, and with secondary care understandably focusing on COVID, the disruption to the health economy could be massive. It would seem, therefore, a perverse decision to reduce the primary care provision in the city at this time, and a decision which could have a considerable negative impact both on patients and on neighbouring practices operating in one of the most deprived wards in the city. 4. There are about 100 homeless patients on the Guildhall Walk list. These are highly challenging patients for whom care provision is time-consuming and difficult. Historically, very few practices are generally willing to take on this group of patients. Since the decision was made public, staff at Guildhall Walk have been inundated with queries from anxious patients who have very real concerns about who is going to look after them once the contract ceases. The CCG appear not to have a firm plan for the patients, other than to conduct a managed list dispersal, whereby these patients are allocated to neighbouring practices according to capacity. 5. In addition to Guildhall Walk surgery, PHL currently operates the Special Allocation Scheme for Portsmouth, South East Hampshire and the Isle of Wight. This scheme comprises approximately 78 highly challenging patients and will be difficult, if not impossible, to deliver without a GP surgery base. In light of the above, we have therefore urged the committee to reconsider its decision and have indicated our willingness to work with the CCG and other stakeholders to ensure that patient care in Portsmouth is not compromised. Again, we have not had a response from the CCG to this offer. In summary, we consider that the CCG's decision has been made without proper consideration being given to the impact that this will have on the healthcare system, and without having any credible rationale for making its decision. Should you require any further clarification, I would be delighted to hear from you. And that was from Mark Stubbings. He's the Managing Director for the Primary Care PHL. That's Partnering Health Limited.
Thank you very much. Thank you very much, Jane, and very well read. I could understand every word you said, so thank you for that.
Thank you.
And Jane, before we go over to Councillor Corkery, has he got a time limit or not, or can he talk as to make his deputation?
It's at your discretion, but normally it'd be 6 minutes. But
okay, okay now. So, Councillor Corkery, I've now called upon you to make your deputation, and plenty of time within reason. Thank you very much, Councillor Corkery. Thank you.
Thank you very much, Chair, and thank you to the panel for giving me the opportunity to come and discuss this issue today. So I'm one of the councillors for Charles Dickens Ward, which is in the city centre of Portsmouth. As was mentioned in the deputation, as people may know, it's the most deprived wards in the city, and I fully expect the most deprived ward in any of the local authority areas that are represented here today. With that deprivation comes need, and in particular needs for access to health services. One of the factors that Charles Dickens scores in kind of the most deprived is in terms of access to health services and the rate of disability. And I know that this practice in particular caters significantly for that population and is a really well liked and needed resource for the community. Over the course of the previous week, since we were informed that this decision had been made, we as ward councillors have engaged with the CCG, with the current provider, as well as with a number of patients currently registered and using the practice, to try and understand in detail a bit better what the issues are and what alternatives have been explored, if any. I've got a number of points I'm going to run through today, which I think are outstanding in response to those investigations we've made. And then I've got a request that I would like to put to the panel, if I may. So the first issue I want to talk about is consultation and what consultation has taken place in relation to this decision. I have to be honest, I don't think any consultation really has taken place in a meaningful way. We were informed as ward councillors that the decision had been made. And I think this was on the Thursday, with it due to then go public on the Monday, and with patients to be informed on the Monday. At that point, there had been no consultation whatsoever with patients or their elected representatives about what the impact of this was going to be and whether it's the right thing to do or whether there were alternatives. I hope you would agree with me that actually when we're talking about changes, quite significant changes to how public services are delivered, consultation is really important and needs to be prioritised so that people can have their say. The second point I'd like to touch on is one of the arguments that seems to have been made by the CCG as the rationale for this decision, at least in part, is the concerns around the viability of the existing service. I think they've talked about the patient list being 8,400 people, which is the smallest in the city, and they've kind of queried about whether that is viable going forward. I don't know the answer to that question, but I know that I've spoken to the provider and they are very keen to continue running the service, which I highly doubt they're going to want to do if it's not viable. They've clearly been able to make the figures stack up to now and don't have any concerns themselves as the provider on the ground about the viability of that. The next point I want to talk about is the estates issue. So clearly that is a key issue in relation to this decision. There's been apparently uncertainty about the future of the building and whether the landlord is going to allow the health centre to continue in place or whether they're going to increase the rents up to a much more significant level that makes the practice unviable. My understanding from speaking to the current provider is that these negotiations were still ongoing and in fact progressing at the point the decision had been made. So I don't think it's necessarily the case that this is a decision that had to be made, that alternatives could have been found to allow the practice to continue in place. And the other point on the estates issue is that alternatives do exist very close. Obviously, one of the things that's been mentioned today is the Somerstown hub, which is a kind of short walk away, which I didn't realise until this issue came to light, actually effectively has a whole GP practice, which has just been mothballed, empty rooms, which are being paid for by the CCG, but not being put to use, which I personally find incredible. But clearly there's that space there that could be used if it was deemed appropriate. There's a second alternative premises, which is actually much closer, within 200 metres of the current location. And this is an empty, long-term empty Portsmouth City Council owned commercial unit, which has got hoardings all around it saying this place is up for rent, come and put your business here. And actually one of the suggested uses on the hoardings is a new GP surgery. But apparently the council and the CCG haven't fully explored this option, which again I find quite remarkable. I would have thought, given the proximity and the fact that it's been empty long term, this would have been number one on the agenda to look at whether the GP practice could be moved literally just around the corner. The next point I want to talk about is timescales. Again, the timescales have been suggested as a reason why this needs to be done and why there's no alternative, because the current contract ends in September and there may not be time in order to find an alternative premises. But the question I would ask on that is, if that is the case, if 6 months isn't enough time, then why wasn't this looked at 3 months ago or 6 months ago when there would have been enough time to look at the alternatives? I just worry that actually sometimes when we're presented things and there's very little time to get them changed, we're presented with a done deal, which then there's no kind of reasonable alternative available. The next point I'll kind of have discussed with the CCG, but to be honest, I wasn't quite clear on what the response was, is what impact has been done on the equalities impact assessment in relation to this decision. Now, the response I got was that an equalities impact assessment hasn't been done because the decision being taken is not to renew a tender, as opposed to, or not to renew the contract, as opposed to actually kind of actively closing down the service, which sounds to me slightly pedantic. And given that we know that there are a significant number of people who use this practice who are represented by the protected characteristics under the Equality Act, the homeless people have been talked about today. Also know that that area in particular, there's a high density of people for who English is a second or third language, in addition to other vulnerable groups. I think that actually looking at what the impact on those equalities groups is going to be is a really key consideration that needs to be kind of front and centre of whether what analysis is being undertaken to determine if this is the right thing to do or not. Another point I'd like to mention is that this premises in the evenings and at weekends is used as a safe space. So it's right at the heart of the Portsmouth nightlife economy, lots of clubs locally. And this place is used by the ambulance service as a safe space for people that are vulnerable, or perhaps women who feel unsafe or that particularly vulnerable at night time, a safe space where people can go and access support. So again, I'd raise the question of where this service is then going to be located if these premises are no longer made available for that purpose. And just the last point before I conclude is it's been suggested that there's capacity elsewhere in other neighbouring practices that would allow these patients to be reallocated to. Now, I haven't seen any evidence of that. I know we've been told there's capacity, but I would be interested in just knowing the figures. I mean, how many patients are already registered at those practices, what the GP to patient ratio is. Is it reasonable to say that there is capacity? And I say this as a patient at one of the local practices where it has been suggested there is capacity. And let me tell you, the experience of a patient trying to book appointments does not suggest that there is massive capacity to take in thousands of new patients. So I really would question that assertion and would be interested to see any evidence that lies behind it. So in conclusion, I think I've laid out a number of ways in which I think the process to date has been inadequate. And I do have concerns that this has led to the wrong decision being made without alternatives being properly explored. I think there are a number of alternatives which could work, but just haven't been looked into in enough detail. So in light of the request that was made by full council, I would kind of echo that really and suggest to the panel that a position being taken of opposing GP surgery closures, and in particular this GP surgery closure, and a request put to the CCG to reconsider their decision. Thank you.
Thank you, Councillor Corkery. Some very good questions there. I hope Joe can answer them in due course and reassure you, or reassure us what's going on. That would be great. So before I move on to that, members, you've read the report. Joe, I believe you'd like to add something before we go to the members to answering any questions. So I'm going to hand over to you first of all, Joe, please, if I can.
Thank you, Councillor. My colleague today, Simon Cooper, Director of Primary Care, is also with me. He may be able to provide some more detail should we require it, but I will endeavour to answer as many of your questions as possible. Do you want me to pick up on some of the key points that have been raised in terms of those deputations?
Yes, please. I think before we lose anything, because obviously there were some very good concerns from Councillor Corkery, and before it all gets thrown in the mixing pot, if you could go over some of his, I'm sure you've written a few details there, and then that would be great. Thank you.
Absolutely. So I think, so first of all, the decision that the Primary Care Commissioning Committee has made is not to re-procure the contract, the alternative provider medical services contract that we currently have for the Guildhall walk surgery. And that's a time limited contract which has already been extended and is due to end on the 30th of September this year. Because of procurement rules that the CCG is governed by currently, we're not in a position to extend that contract further. We would have to go out to re-procure that service, and I think to direct award that service to any one provider we would be challenged by, because there are a number of practices in the city and in other areas who may wish, should we have taken a different decision to re-procure that service, who may wish to. So PHL as the current provider of the service, they may not, even if we'd taken a decision to re-procure, they may not be the provider moving forward. The reason we made the decision not to re-procure that service, to allow the contract to come to an end and to provide medical services to that 8,400 population through existing provision in the city, is a number of factors. One of which is the building. It is in poor condition, and that has become ever more problematic over the years. There is the issue around the landlord, and I can and the position we're in with the landlord, which is that a new landlord has taken over. We've had various discussions with him. He is looking to do something different with the building. However, he has now, subsequent to the report we submitted to HOSP, put in a request for a Section 25 that is either we sign a new lease, which is considerably more expensive given the quality of the building, or we need to, if we're not going to sign that lease, find alternative premises. So because of this contractual change and the issue around the building, we have made a decision not to re-procure the service. And in part that is because, as Councillor Corkery pointed out, we've had that conversation with him. We do believe we have existing capacity. We're not reducing provision in the city. We have existing capacity in the city. And that is in part because of the investment that we're putting into the university practice, which will move to next to the old Marks and Spencer's building on Commercial Road by the end of this year. So that building's due to be complete in December 2021. So gives the university practice considerably more space than they currently have, and allows them to grow and to reconsider their population. And we've been having those conversations with them about not just being a university practice if they're in the city centre, and they're very keen to work as part of the primary care network in that area, and to take on new support. They have got that capacity. And the other practices in the local area also have that capacity. So we know, and I can come on to that a bit more. So we know that there is capacity in the city. We're not reducing provision, but we felt that continuing this small practice, it is the smallest practice, going out to a procurement, which may mean one of the other practices in the city takes on the contract and may then move all of the patients to a single location. We felt actually the decision we made to end the contract and to work with patients in a managed dispersal, which I'll come on to in a minute, to get their care from another local practice. One of the issues that we've talked about is the vulnerable people and the homeless provision in the city. And Councillor Corkery was right. When we met with him, we hadn't undertaken an equalities impact assessment. If we'd made the decision, and that's in some ways, we recognise that is about our rules and our processes. Had we been taking a procurement decision, we would have done that. The fact the contract came to an end, we hadn't done that at the first stage. We are now doing that, and that will be reviewed by the committee. But again, we don't feel we're reducing provision in the city, because we have 4 practices all within half a mile who've worked with us and have reported that the ability to take on additional capacity. And that is because, as we've heard, care is being provided in very different ways through the pandemic. More telephone consultations, more electronic consultations, e-consult, which when we've done some work with patient groups, actually people they enjoy this kind of approach. They see the benefits of it. That's not to say it works for everything. We do still need face-to-face care and provision, and we need to think about that in different ways, not just within buildings and bricks and mortar. And all of our practices are looking at how they can do that. So an example, again, we've talked about homelessness and the 100 homeless registered patients at Guildhall Walk. We have a number of provisions going on in the city. So we've been piloting a service. It started pre-COVID. It's had to change quite dramatically through COVID, and we'll continue to change that, working with other practices in the area. And we've been doing much more outreach support, and actually the way we've managed vaccinations in the city, we've been at the forefront of vaccinating our homeless population, and that has been a much more outreach peripatetic service, which in doing that we realised that works for that population group. So some are reluctant to register, and even when they do register, that they are fearful of going into traditional healthcare settings. So we're continuing to work based on the learning over the pandemic, the pilot we had started, continue to work with the public health department in the city council and our practices to set up broaden that outreach approach. We are also going to work with PHL to think about how we can support those most vulnerable patients more. I think picking up the estates issue and the specific issue about the Somers Town Hub and Chaucer, yes, we have. We did explore Somers Town Hub. We have been paying for the void in previous years. We've been doing a lot of work as a CCG to look at that. We filled that space with the long-term conditions hub prior to COVID, so again providing additional services there. We have been looking at dental practices going back into the Somers Town Hub, which is planned, and we know that the Portsdown Group practice are also looking to expand their current capacity in there, all of which will reduce those void space. So you say we did talk to PHL initially when we knew there was uncertainty around the building about moving into the Somers Town Hub. The practice themselves were reluctant and only saw that as a short-term move, and we recognised that putting two practices together in the same environment can be problematic and destabilising for both practices. It can cause patients to move very easily and also staff. So it's not an ideal situation to have two practices so closely located together. So that was why we ruled that option out. And as we say, PHL were reluctant to see that as anything other than a short-term move. The way NHS capital funding works is quite complex, and we have looked at Chaucer, but Chaucer would require, it's an empty shell of a building, it would require a full refurbishment. We don't have that capital resource to put in. We would be dependent, so the practice or the provider would be required to do that. Again, given the contract issue, that wasn't viable. We also don't believe, having worked with the council on Chaucer previously, we don't think it has the right size to accommodate this particular practice. So again, and the other issue Councillor Corkery raised was safe space, and I just wanted to reassure around that the safe space is has been closed or not operating in the way it always previously has over this last year as a result of the pandemic, but we are continuing to work with the and we were already actually pre-pandemic we were already exploring other venues for that, because we didn't feel it was no longer appropriate in the Guildhall Walk premises. And also there was the issue around the landlord and the lease and the cost of that, the usage of that becoming ever more expensive. So we had already been considering that. As I say, it has been closed. We are looking again at what do we need for that service. Do we need those services in the same way? But we'll be doing that in consultation with Public Health and the ambulance service. We were talking about that later today. The special allocation service that PHL also provide, they had given notice on that service. It's a bigger service than just Portsmouth. And so it's provided to other CCGs. The majority of that is provided either by telephone or electronic consultation. Even before COVID, only a minority was face-to-face provision for that patient cohort group, and we're looking at other provisions for that. So that would require a different solution regardless of what happened at Guildhall Walk. It is separate, and we are, and as I say, PHL had given notice to us on that. We're working with our local PCNs to see if we can develop a local solution, or we'll continue to work with other CCGs to provide that more at scale. So they were some of the points I just wanted to pick up, but I'm aware there'll probably be other questions. So
just
happy
like
to take those as well.
Thank you for that, Joe. Councillor Corkery, is there any questions that you asked that you feel haven't been answered before I move on to members?
Thank you, Chair. I think that's covered most of the points I raised. Thank you, Joe. I think perhaps the one thing that I'm still a little bit unsure about is the alternative capacity and what assessment has been done in terms of, I mean, I'm not sure what measures are usually used, but probably something like the patient to GP ratio, or how has it been assessed that there is space elsewhere? Thank you.
Thank you, Joe. If you could answer that, and then I'll go over to members, because I think Councillor Leo Madden wanted to come in first. So can I ask Joe, could you answer that, please?
Yeah, so the patient to GP ratio isn't really an accurate one, given that so many of our practices now work in so many different ways, and people see practice nurses and other roles, other practitioners for so many of their healthcare needs. So what we have done is worked with initially the 3 most local practices to Guildhall Walk to really understand with them what was an accurate, did they feel they could take on any additional capacity. As I've said, the university, because they're moving to a new building, because that has given them more capacity, already had a plan for growth, both in terms of the university practice, but over the last year, we think that population could look very, very different moving forward. So they really do have capacity of about 6,000 space. They feel they could comfortably take on an additional 6,000 patients. Similarly, Portsmouth Group, they are already, as we know, they are one of our largest practices in the city. They have done a lot of work, both pre-COVID and post-COVID, to look at how they provide care, to do more electronic and telephony. They all have a total triage model now, which is really, really effective, and all practices are operating that, which means they can actually reduce some of the waits for patients. So Portsmouth Group feel they could accommodate approximately 2,000 additional patients. The Lighthouse Medical Group, South Sea Medical Centre, feel they could comfortably take, with support actually, take on 800 to 1,000 patients. We were then also approached by John Pound Centre to say that they could take on a further 2,000 patients, potentially more as well. So that is over the 8,400 patients that are currently at Guildhall Walk. We're also working with those practices to look at what additional, if any, support they may need to take on that additional patient capacity. That could be around telephony, infrastructure support, or it could be around support for GPs. We know with regards to the Lighthouse practice in particular, they've been struggling to recruit GPs because of the size of the practice. Actually being able to take on a bigger patient cohort makes them more sustainable as well. So we believe we have capacity. The transfer will be done, I can talk more detail on that in a minute, will be done in a way that gives patients the choice. Nobody will have to move more than within half a mile of where the current surgery is located to get that continued provision of medical care. And the way the process will work is when particularly if somebody registers online, we can talk about this more in a minute, they will get a detailed look that looks at what, from their address, what practices are in their boundary, and they will have a choice of those practices. So talked about the first 4, but it's likely that for an individual patient, they may have a choice of other practices within their the boundaries cover their address.
Thank you, Jo. Although Simon, did you want to add something specifically on that question before I go to members, which was Councillor Leo Madden? So Simon, did you want to add something specifically to that before I go to Councillor Madden?
Yes, please, if I may, just to pick up on one of the elements that Councillor Corkery mentioned regarding what is a viable number of patients for a practice. I have been desperately in the background trying to find some information around that, because it is quite a difficult thing to specify an individual number, but it might give you some guidance. I have just looked at the last 12 months of practice closures within England that I can see the data for. It's not always easy to pull out of that exactly what is a practice and what might be what we would call a dummy service that would come within that data set. But we are looking in the region of 5,500 to 6,000 patients is the average size of practice closures over the last year. That has gone up to a maximum of around about 16,000. So obviously those closures may be for many different reasons, but the list size for Guildhall Walk is only just above that list size for the average number of closures, and that would actually, it gives me some confidence in those figures, in the fact that the Queen's Road closure, where the practice decided to hand back their contract some years ago, was at or about that level of capacity in terms of patient numbers. So there is some robustness in those figures. In an estimate of around about 5,500 to 6,000 is currently the level at which practices seem to be handing back their contracts or requiring to close either via a merger or another means. And the direction of travel is only to increase that number over the years that we've seen recently. So I hope that gives you that an answer, at least some way, to that question.
Thank you very much, Simon. Yes, Jo.
Sorry, and I was just to add to that, I think we have done quite a lot of work in the past and continue to do so with our practices to manage that sustainability, to increase their viability and to get them to work together. And the primary care networks is the latest example of that, so that they can share services and stuff and become more sustainable, because we recognise that the smaller practices can be unviable, and so again we feel not re-procuring this contract will increase the sustainability of a number of practices across the city.
Thank you very much, Jo. So I'm opening it now to the floor, and Councillor Leo Madden was first to ask questions to the panel. Councillor Leo Madden, thank you for waiting.
Thank you very much, Chair. Could I, first of all, I can't, I'm reading this report on another laptop. I can't see what the recommendations are in relation to this report. Is it just to be noted, or is there something else?
Yes, Chair. It was to be noted and to update HOSP on their position. We had originally put it in the.
Joe, that's fine. That's all I want to know. Okay.
Oh, yeah. I was sorry, Lee. I was just going to say we had
that's fine. What I'd like now to know, and I can't see that we've got any legal person here, Chair, but I'd like to know what the remit of this committee is in relation to issues like this, and whether we can send it forward or oppose it or agree it. I mean, I'm not sure what our position is in relation to this, and I don't know also whether Health and Wellbeing Board come into this. Anybody want to answer that?
It's a good point, Leo. Councillor Madden, all I've got here is just to answer any questions and on the report. Jane, can you give any feedback to Councillor Madden?
Yes, I can try, Chair. The panel has the remit to challenge and to scrutinise any change in services, for example, closures and not continuing procurements of services on contracts. You can, if you're not satisfied that enough engagement or consultation has been carried out, you can require further consultation and for the details of the consultation and the impact. We have a framework we could, the panel sometimes asks of commissioners and providers to complete, so that would come to the next meeting. And you'd get a much more detailed analysis of everybody that the CCG has worked with, the impact and the consultation. Sorry, if that answer your question, Councillor Madden.
Councillor Madden.
Can I just chip in there quick, Chairman?
Well, I did call Councillor Madden, so sorry. Councillor Iger. I'm going to go with Councillor Madden just for now.
Just making a point of information for you, Chairman.
Yeah, please go ahead, sir.
Fine. Ask Joe if she would send you the terms of reference, which is the Portsmouth Health Overview and Scrutiny Panel. There are 7 items on there, and they define what we should and should not do.
Okay.
I got a copy.
Okay. All right. Thank you for that. I'm going to go to Leo Madden for the minute. We'll keep this going for a minute. Anyway, Councillor Leo Madden, you've heard from Jane. Any thoughts on that, Councillor Madden?
Well, yes. I mean, it's just that we are a scrutiny panel, so therefore we scrutinise to make sure that whatever arrangements are in place, we make sure that they've done properly. Councillor Corkery's mentioned a bit which always concerns me about consultation, and whether we're properly consulted in these or not. I mean, we've had some recent ones, of course, as we were told, and you can see what the council is concerned about is seeing surgeries closed rather than open. in Portsmouth, you know, and that's a concern of people, you know, and it's certainly a concern I would have. But what I want to address, if I may, are some questions from, and Joe or Simon could answer them almost immediately rather than wait to the end. And if we look at the background to it, we see that clearly there was an extension of a year for the Guildhall Walk. I don't know whether it was because there was public agitation about it or whether in fact it was something that the CCG decided to do. But having done that, it was a year's extension. Now I've got to go back, and Councillor Courtney is right, and I'd looked at this myself anyway. We were first notified that it was closing on the 24th of February. Now that's 3 weeks ago. Right. Now if this facility was kept open for a year, why wasn't there investigations done then into what should happen thereafter? But again, it's on the cusp of closing, and the CCG come to, with all sorts of, I mean, the viable reasons. I'm not saying that. But what I'm saying is that it's not a proper consultation exercise. What it is an exercise to say, we're closing this. These are the alternative provisions of surgeries that we've got. What do you think? So, you know, I hope in the future when and I understand, obviously, if GP surgeries were closed because people are retiring or whatever, it could be done at short notice. I understand that. But in this occasion, there was a year to do that, and nothing happened. Can I ask how many, what is the split of the 8,400 patients? Are they from all over Portsmouth, or are they mainly in and around Guildhall, i.e. St Thomas?
Okay, who would like to answer that? Joe or Joe? Couple of concerns there.
Yeah, so I think, yes, you're right. We did extend the contract for a further year last year. Our intention at that time was to consider whether we needed to do a full re-procurement on the service, and would that be the best opportunity, or again to decide not to re-procure that contract. I suppose some of the part of the problem for us around that, if you like, was coming into the pandemic. We paused a lot of our contractual work to focus on sustainable delivery during the pandemic. We were then, I suppose, from September, October, had the issue of the landlord and what felt very much like this threat over whether or not the building would be available to us. And therefore, we also had, and the cost of that building as well, because obviously the landlord is, the conversations we've had with them and property services and the practice has been either that there would be a notice to quit, which hasn't happened, but which we were expecting, because we are aware he's put in planning permission for another use, or that we would have to pay a considerably higher rent. So what we have had to do during the course of that year is make a commissioning decision around what to do with that contract. And given some of the changes that have been made during the course of that year, with the pandemic, the increase of moving to a total triage, which we know has increased capacity from some of our practices. We've also been working with the university practice. We've had the considerable capital investment within that service. And the issue around the building and it becoming unaffordable in the current service, we felt actually we didn't need to re-procure that service. We could continue to provide medical care to those patients through existing provision, all of which is within half a mile, of the current site. So that's why the decision was made not to re-procure the contract. So it was a contractual decision that we were making to let the contract end, because it has to come to an end on that date.
Councillor Madden?
Yeah, Joe, you're going over old ground. I mean, we'll be here all day. If you just, all I want is an answer to the questions. One word will do me, that's all. I mean, you've told us about the rent going up and the possibilities of that. But the fact of the matter is that the lease was only extended for a year. Now, someone at an early stage, i.e. 9 months ago, should have been looking then, and they probably were, to see what was going to happen about it. And it would have been nice at an early indication, even on a confidential basis, to HOSP and to the local ward councillors to say the chances are, for these reasons, we may not renew this. But that didn't happen. So all I'm asking really is, because the decision has been taken, the decision's not going to be reversed, is it?
Joe?
I'll wait for an answer to that, Joe.
Yeah. So, yeah, I take.
Has the decision been made, Joe?
Yes. So the decision not to reprocure the contract has been made by the CCG Primary Care Commissioning Committee.
Okay.
Right. That's great. 1 second, Joe.
Oh,
sorry, Joe. Councillor Madden.
It was a yes or no answer. You're right, Chair, and I've got the answer. So it's not going to happen. I don't want to be sitting here all day asking questions, Chair. Could I get succinct answers, if needs be, from the CCG representatives rather than all the detail as to why they've done it? I don't feel happy about the lack of consultation and the fact that this is just pushed to us. I don't know what. That's why I asked the question earlier on. What are we allowed to do with this? Could I then go on to the committee's decision? Now we've got a paragraph saying that all these people decided it was going to close. I have no idea when that happened, and I'd like to know if the minutes of that meeting are in the public domain, because I have no idea who these people are. Most of them, I don't know. An officer, I don't know who that is. A public health lay member, or is that a public health lay member? I presume the lay member is a member of the CCG anyway. And I am surprised if and I don't know who voted what way, but are you telling me that Healthcare, Health Watch voted for the closure of this? But if the minutes in the public domain, then I'll look them up, Chair.
Yeah, thank you, Joe. Very.
Thank you. This was a contractual decision. So the decision was about whether or not to reprocure the contract, and the decision was to end the contract. Yes, we have a member of Public Health on the committee, NHS England and Health Watch. Because it was a contractual issue, it was undertaken in part 2, so it wasn't undertaken in our public meeting. A paper is going to the committee next week in the public position that looks at the alternative provision for those patients now that we will not be extending that contract. We'll not be reprocuring that contract, sorry.
Thank you, Joe. We've got Simon who wants to come in there, Councillor Madden. Simon, did you just want to specifically pick up on the bit that Councillor Madden said there?
Yeah, there was one point that Councillor Madden asked, I don't think we've answered yet, in terms of the spread of patients across the city. Whilst you would expect the vast majority to be around the practice site, there are lots of patients spread around the city, but I would just put a bit of caution around some of those numbers because, as Joe's previously said, we are seeing patients move to other ways of accessing their primary care services. And just one point regarding the significance of the change of the services. I would ask perhaps you consider whether closing a site, whereas we are maintaining practice patients' access to GPs, is a significant change to services. It's because as Councillor Corkery intimated previously regarding void space, and how that was something that we didn't feel that we were comfortable with, having void capacity within very close practices within less than half a mile could be considered to be a similar situation.
Thank you. I'm going to go over to Councillor Leo Madden in a second. I just want to welcome Councillor Graham Heaney here. Good afternoon, sir. Have you, first of all, got any declarations of any interest, Councillor Heaney, at all?
Thank you, Councillor. No, I don't have a declaration of interest. Apologies for being late.
Thank you. Thank you very much and welcome. We will get to you. You are on my list, but I'm going back to Councillor Leo Madden. Councillor Madden, sorry about
that. Thank you, Chair, and thank you for that information. Yes, I think that any change whatsoever other than moving next door, should actually come to hospice. Now, and I suspect in most occasions hospice has done this past will agree with them. I think the problem is, as I keep saying, it's the lack or the perceived lack from our position of proper consultation. This has been set on for some time as far as I can see. There is concern, as I said earlier on, of the number of GPs closing, and I know service will be provided in different ways as time goes on. I would then, Chair, I'm not going to ask any more questions. But just arising from the question that came to Council the other day, I'd like to make a recommendation, and I've taken the words I think as best I could from what was there, and I think that this panel should ask the CCG to continue consultation with all relevant individuals and organisations to come up with an alternative practice as close as possible to the current surgery. Now that's all it's asking, that because we have until September, I presume. So I move that, Chair. Need somebody to second it. But could I ask one last question? Are there any staffing consequences to the closure of Guildhall Walk?
Who would like to answer the second point?
I'm happy to answer that.
Second point? Yes, please, Jo. Thank you.
So, as we've said, PHL are the current provider of the practice. They're a large organisation. We are aware that they were looking to recruit additional GPs because they had some turnover in staff recently. We are working with them to understand if there are likely to be any GP implications, but we will also work, as we say, with other practices to support any changes if staff are, wish to work in other practices, if there are vacancies in other practices. So we will continue to work through that with PHL and also to understand what the impact on the staff is from their perspective. Like any organisation in healthcare, and we heard from the Trust earlier around recruitment and retention, we know working in the pandemic has been hard on all of our workforce. So they will be continuing to look at other opportunities they can support their staff with within their organisation, and we will support that once we understand if there are likely to be any GP implications, and also if there are other practices with vacancies as well. We will pass those details on.
Thank you very much, Jo. Thank you, Councillor Madden. I'm going to move on now, Councillor, if I can, to some other people, if that's okay with you, Councillor Madden.
Chair, what are you going to take my recommendation?
Yeah, I'm going to have. I'm looking to see if anybody wants to second that. I was going to come to Councillor Arthur Argate as well, but does anybody want to second what Councillor Madden has just said at all?
I'm happy to second that, Chairman.
You're happy to second that. So, Jane, do we need to vote on that? And then Sorry, Jane.
Yes, Chair.
Okay.
Voting now, please.
Yeah.
Unless there are any other recommendations.
Anybody ask for recommendations? Are we still allowed to carry on to talk about this, or do we just get into the voting, yes or no, Jane?
You can carry on talking about it. Discussion as far as you'd want to.
We've got a proposer, we've got a seconder, so we'll read that out in a minute when I've taken everybody that wants to have a talk or wants to have a view on something. So my next person on the list was Councillor Arthur Ago, please. Councillor, over to you to ask a question first of all, please.
No, I haven't got my hand up, Chairman.
No. Okay, then I had Councillor Graham Heaney as well that wanted to say something. Councillor Graham Heaney? You wanted to ask a question to Jo or Simon?
Sorry, I've gone mute again. Hang on. Yes, first of all, apologies for being late. I was working. I may be asking something which has already been answered, so I do apologise for that. But the question I wanted to ask is, has any discussion taken place with the health lobby about the provision of GP services and the impact it may have on patients for the loss of the surgery in Guildhall Walk?
Who would like to answer that one? Joe again, or Simon?
I can answer that.
Thank you, Joe.
We so we haven't taken this directly to the Health and Wellbeing Board. We have, however, been working closely with public health officers and with Councillor Winnington around this decision and the need to take this decision around the not re-procuring the contract. Again, I think it's important to remember that we are not leaving people without a provision. They will be provided with medical care within half a mile of the current site through a managed transfer process. That means they won't have to go out and register themselves with another practice. They will be, we will be holding engagement events in April, and at the end of April we will send a letter to all the patients registered at the practice. It will work on their individual address and the boundaries, and they will be given a choice of 5 or however many practices fall within their practice boundaries fall within their address, and they will be given a choice of 3. So we will then collate that information. The majority of people will get their choice of practice, alternative practice, and that record transfer will then happen in August. So patients will be offered a choice of alternative provision within 1 mile of the current site.
Councillor Heaney, did you want to have a follow-up question there, or were you happy with the explanation?
I mean, I understand they're going to be offered a choice, but I think the concern that I've been hearing is that losing a location may impact on accessibility and people moving to a strange surgery of which they have no knowledge. I want to be clear that patients are going to be followed up. I don't know what the surgeons are going to do to actively engage with their new patients, because surely if people have conditions, or maybe reluctant to visit surgeries, they've been going somewhere where they're not confident, they may not come to a new surgery because they're unsure. So I'm just concerned that the engagement is not going to be good. Secondly, I'm not quite sure why this hasn't been referred to the Health and Wellbeing Board, because they are surely a strategic body about the provision of services, and I'm really surprised it hasn't. And I'm wondering if we could ask for the Health and Wellbeing Board to give their view on this to us as Health, Wellbeing and Scrutiny.
2 concerns there I've picked up. Simon, do you want to answer both of them?
Can I pick up the first one?
Yeah.
So in terms of practices engaging with new patients, as a clinician myself, you would not start to care for a patient until you've actually made those links and understand those nuances within that patient beforehand. So as a pharmacist, I wouldn't be prescribing until I understood that, and if I wasn't comfortable that I didn't have anything in terms of at least initially those records, etc., to understand that, I'll be directly making contact with those patients. There will be engagement processes around those patients landing to make them feel familiar with the services that they're now available with. But it's also worth mentioning, as Joe said, is that the current provision in terms of their struggle to maintain GPs and nurses, that was an ongoing cycling process for the current provider anyway. So there wasn't that familiarity with an ongoing familiarity with an individual clinician.
And
yeah,
just
Joe. And
just to pick up
go on to somebody else, Joe.
On that. So whenever a new patient registers with a GP practice, there's a registration process, and a new patient will usually meet with a member of the practice team and have an assessment. So again, that will be part of the receiving practices requirement. What this process will do is take away the need for patients to go out and find, to go through that registration process themselves. It will all happen automatically. All they need to do is respond with the choice of preferred other practice. I think, again, the reason this hasn't gone to Healthwatch, although we have been working with council officers around an estate strategy, is because this has been a decision that around whether or not to extend a contract. So that perhaps has meant there was less of a need to go to the Health and Wellbeing Board. It is, again, our view would be it's not a substantial change in services to those patients, because their care will be provided. They will still need to get the medical services provision that they require. We're not reducing that provision at all in the city, as we've talked about. We have got that additional capacity, and I think, sorry, I was going to say something else, and it's, oh yeah, so because the alternative is to re-procure the service, there would be a change anyway. So PHL may not be the provider. So apologies, that's my doorbell. Somebody else my husband's in, he'll get that. Probably my children coming home from school, apologies. Yeah, so because we have the choice, it was either to end the contract, which is the decision we've taken for the reasons we've given, or to re-procure that service. So that could have meant a different provider. So there would have been a change, potentially under that route would have been a change anyway. And we talked about previously, either the university practice or Portsdown Group practice, who are local practices, may have won that contract and may then have looked to move the provision into Somers Town Hub, where we've talked about space issues, and as we've talked about, the university moving into a new building. Alternatively, it could have been a provider from outside of the city, and who they may then have had different longer term plans. So that's why we made the decision not to re-procure the contract, and to work with the patients to provide their care within the local area where we have got that capacity.
Thank you very much, Jo. Councillor Heaney, any other quick points before I move on to Councillor Philip Raffaelli? Sorry, Simon, you wanted to jump in quickly.
Sorry, can I just add to what Jo's comments were? So if I could give a potential example. So if, for example, we did go to re-tender and Portsdown were to take that on, they would be fully entitled to provide the services from their current sites, but that would result in patients not having choice and would end up within that practice. So we're in a bizarre situation where the decision to make actually gives patients more choice than a potential other solution.
Okay, thank you for clearing that. Graham, sorry, Councillor Heaney, I know Councillor Raffaelli has been very patient.
Just want to come back very quickly. I mean, whilst I understand the contracting process is a process that doesn't necessarily involve substantial change to services, because we're providing it, for patients who are affected, it does feel like a substantial change, and it's a substantial number of people who are affected. So I'd like to ask my question again: can we as a house refer this to the Health and Wellbeing Board and ask for their view on this change?
Thank you for that. I think we're going to take a vote. We're going to have a vote on something later on, Councillor Heaney. So,
well, I understand that, but I'm still asking the question: can this be referred to the Health and Wellbeing Board, and can we get their view on it? Because there is some time to do this, and I want to know whether that's a possibility.
Right, Jane, I'm getting a little bit muddled here. Jane, is that a possibility for us to do that?
I would look into that, so that I give you the right advice.
Okay, I have to wait for that little bit of advice. Thank you for that. A little bit lost where I am. I think I'm going to go to Councillor Philip Raffaelli first of all. Sorry, thank you for being patient.
No, not at all, not at all. It's a very important discussion.
Yes.
I think we've been slightly distracted, if I may say, perversely, because we're arguing about whether this is a good decision or not. It may well be a good decision, but I don't think that's the issue that's really been raised here. Jo's alluded to being whether this is a significant change of service or not. In the past, when that has been debatable, the practice has been that the commissioning authority or the trust has brought that discussion in good time to this committee to have that debate whether it's a significant change of service or not. If it is a significant change of service, there is a framework document which I've sent to you, Chair, and to Jane, because we've used it before, that lays down the level of consultation and the types of questions that should be asked in advance of the decision being made. If we, the hospital, without having gone to the Health and Wellbeing Board, are unhappy with that decision, we can say so. If the commissioning body say, well, nonetheless, we're going to go ahead with it. The framework document gives us the authority to raise this to Secretary of State level. I mean, that's playing really hard ball. What disappoints me here a little is this was extended a year ago. I understand COVID's been on, but there's been no interim discussion on what's inevitably going to be a change of service to a greater or less degree to allow this committee to give an early view and shape what that outcome may be. So I think there's been a step missed here that should have involved this committee earlier to put into the decision-making process our views on behalf of our community. Thank you, Chair.
Thank you for that. Jane, what do you think to what he's just said there? Is there anything else we can do before I move on to the next one?
It's a bit late now, Chairman.
Yeah, it is a bit late, but I'm
September.
just make sure I know. But okay, well, I want to introduce at this point Councillor Steve Weems, who's putting his hand up. Yes, I'm going to come to you, Councillor David Guest. I'm coming to you, Geese, in a few seconds. I'm just introducing Councillor Steve Weems and just saying to him, has he got any declarations of interest? And then I'm going to come back to you, David. Councillor Weems.
I have my usual declaration, Councillor Fuller, and as I work for the CSU, so effectively employed within the NHS, and currently doing work for those CCGs, so I'm not quite sure whether it's regarded as prejudicial or not in this instance. And in fact, I wish to apologise for being late because Joe will probably appreciate this. I'm been doing work trying to shape the IAPS for the coming financial year.
Thank you for that, Councillor. And if you want to join in the conversation, please feel free to use the RTS. And welcome anyway. I'm going to move over now to Councillor David Geese, please. Thank you.
Thank you, Chairman. I think one or two people besides myself were here when we looked at the walk-in service being moved from this particular practice to St Mary's, and they had a very, very passionate plea, if I remember rightly, from the staff there to keep the service there. And it's almost, looking at this as an outsider, it's almost though there's been a steady wish to sort of actually to run this business down at this particular and close it. I remember previously there was a lot of talk about the fact that it sat right in the middle of the area where it was most needed, where the night economy was, where the homeless, the vulnerable, difficult to reach students, and yet despite all that, I believe the walk-in service was moved to Milton, and this just seems the next sort of step in the closure of the actual practice. I have to agree totally with what Councillor Raffaelli has just said, and I'm very concerned. But one question I would like to ask is the conversation with the landlord. Did this basically start to take place after the decision was made to close it? Because that's how it sounded.
Okay, who could answer that one?
I'm happy to answer that,
Thank
Chair.
you.
No, it absolutely didn't. I think, if anything, it's probably has perhaps muddied some of the waters for our discussion around pre the decision. And I acknowledge from ideally we should have come to you perhaps back in August, September. It's easy to hide behind the pandemic, isn't it? However, I think that has definitely impacted on our capacity and our ability to do the forward planning that we would normally have done around a contract change such as this. I think added to that, around that same time, sort of August, September, we were having the conversations with the landlord around notice, the lease, increased cost. And so again, back then we were focused very much we were focused very much on a position where we thought we were going to have to move the practice quite imminently, because that was the conversation at that time with the landlord. I think we recognise that we've got learning to do around how we work with HOSP in the future, and to bring some of these decisions at an earlier stage, and that would absolutely be our intention. And certainly where we have done more substantial service changes, we have always endeavoured to do that, and we really value the working relationship that we have with yourselves. So I can only acknowledge that, and I think, yeah, the conversations with the landlord were in advance of closing the practice. At that point we were thinking, really, do we re-procure? We've always had long-term plans around sustainability and concerns around sustainability of the practice, but we were looking at how we could think that through and work with the alliance. But yes, the conversation and the issue with the landlord perhaps change that decision. And as I say, we were very concerned we were going to have to move the practice quickly, which stopped us doing that long-term planning.
Did you want to go back to that, Councillor, before I move on?
I think basically you really, the approach to this committee should have been different. You really should have come along and put the actual reasons that you're just starting to give us now as the reasons why you've had to move. I mean, it's taken a long time to get this out of you, but we've got there eventually, I guess.
Okay. Joe, did you? Yeah, okay. Just a statement, was that, Councillor, or a particular question to Joe?
Just a comment. Just a comment.
Comment. Okay, thank you, sir. Okay, thank you for your comment. Next person I've got here is Councillor Steve Weems. Councillor Steve Weems, please.
Oh, sorry, I wasn't expecting to speak.
Yeah, have you got right to you want to speak?
Yeah,
Is that right?
that was in when I just arrived.
Okay, all right. Did you want to ask anything, Councillor, or shall I move on to my last person so far?
Move on, please.
Move on. Okay, I've got Councillor Vivian Atwell.
Yes. I mean, thanks for what you've said so far, Joe, but I haven't heard anything about what consultation you've actually had with the current patients. Has there been any?
Joe?
So, no, again, because we didn't feel this was a substantial change around a formal consultation, and that we were making a decision around not extending the contract. It has been an engagement with the patients around that managed transfer of how their care will be provided via an additional practice, and we're going through that process now. We have written to all the patients, making them aware of the decision. We have set up an inbox as well for that. We've had quite a small number, actually very small number of responses back through that. We have been working with PHR, the current provider, around supporting them and communications to patients. We're holding some engagement events during April to do that. We have spoken to PHR about how we could engage with their patient participation group, but it does appear that they don't have an active patient participation group, so we haven't been able to engage in that way. So it's been directly and will be either through virtual events or letters to the patients, and the letters will explain that managed transfer process that will give them a choice of provider. And I think if we didn't make this decision not to re-procure the service, we would be in a decision to re-procure the service, which could provide a different practice, a different provider, a different building, potentially, given the issues we've discussed with the building, and that wouldn't give patients a choice. And we feel that this approach does give patients a choice of a practice that they prefer, and that may be nearer to them, rather than having to move to the Somers Town Hub or the university practice or another building.
Councillor, did you want to come back on that before I move on?
Yes, I'd like a follow-up if you don't mind, please.
Yes, of course, Councillor.
Thank you. Could you just give an idea of what the response has been? What kind of people in favour of closing the practice or not?
We've had very little response from actual patients saying that they're concerned about the closure of the practice. We have had a few a few emails regarding what's the process, how do I register, and we will be getting that information out to those patients as soon as possible. We're aiming to get a letter out early next week and to have the engagement events over the next couple of weeks.
Simon, did you want to come in quickly?
Just in terms of those emails, we've had one from a non-practice patient, member of the public. We've had one from a patient at the practice sharing concerns over the practice no longer tendering. We've had one patient asking regarding the process and how they go about re-registering, and one patient not relevant to the actual re-tendering process, but complaining about the service they've received from the practice.
Okay, thank you very much. Members, I know that Councillor David Geese has got to go at about 4 o'clock, and I'm just mindful that we're going to take a little vote in a minute. I say a big vote in a minute. So does anybody else has any questions before we move on to that? And I'd ask Jane to move out the proposition. Any more questions, please, that we haven't covered already? Okay.
Chair,
yes.
I've slightly changed the recommendation.
Okay, Councillor. Well, I'm going to ask you to read it and in a second, or say it, and get Jane to write it out so we can vote for or against, and I'll go over every councillor so they can have a proper vote for or against, councillor, if that's okay. So anybody else want any other questions on that point before we move on? I'm just ready. Okay, Councillor Leo Madden, did you want to, Jane, if you could hear what Councillor Madden is proposing, please, and I must make sure that again that will be seconded again by Arthur if he's happy to second what you're just about to say. Councillor Leo Madden, please, could you give us the proposal?
Yeah, can I say first of all, if and when it's agreed, I shall email it on to Jane anyway to save her.
Thank you, Councillor Madden.
I can't remember if it was established. Sorry, it's been a long and interesting conversation, and to be fair to the CCG, they've taken some points on board, particularly in relation to as early consultation as possible to anything's happening. I think what I would find useful, but I don't want to put it in a recommendation, is a forward plan for the GP surgeries and for the future, as we do with the City Council, same thing. They may not happen that way, but I think it might be useful because we've known for years, because people like me get older, and a lot of GPs are getting older and therefore will be replaced. People will move from the city. There's various reasons for it. But it may well be that we're going to close down some very good work's been done in relation to GP surgeries anyway, I must say, and a lot newer and a lot fresher than they were when I first came to Portsmouth in the late 70s. So that's been useful, but I don't know if we got an answer to whether this, because the CCG don't believe it's a substantial change, and I think it was Councillor Heaney who asked the question, does this automatically, i.e. the closure of Guildhall Walk, go to the Health and Wellbeing Board?
So, Councillor Madden, Simon had his hand up just before you were talking. Could you be able to answer those quick points, Simon, before Councillor Madden reads that out very quickly?
It was just a quick clarification that might help you in terms of this is a unique situation in terms of this contract. There are no other contracts currently for practices like this within the city. So that may help you or may not, but it is information that you might find relevant. That was all I was going to add to that.
Thank you very much.
Touched on that.
Councillor Madden.
No, that's fine, and I appreciate that. But there are other GP surgeries, and when I was in the Primary Care Trust, many times, you know, it was outlined what might happen in particular practices. That's all, because so and so might go. The building was rubbish. You know what I mean? Yeah. So it's only in relation to that, so that and we won't hold you to it. You know that it may not happen, but with a forward plan, that's what we expect to see happening. Well, I'll read out what I've said, and it's based on the.
I'm sorry.
Oh,
may I interrupt? You did ask me for some advice about whether the hospital can refer something to the Health and Wellbeing Board, and I've just had a text saying that I've got the advice. Well, just about to get the advice. I don't know whether that would affect what you're about to say, Councillor Madden. Would you like to hold on for that, or to have that afterwards?
Well, it's only that in the situation where we decide we think it's substantial. And I would have included as part of the consultation the Health and Wellbeing Board, but I would have thought that if it's got to go there anyway, perhaps that's, or it hasn't, or maybe if it hasn't, that might be separate. That might be a separate resolution.
Just give Jane a couple of minutes or a couple of seconds to have a look. No pressure, Jane.
Thank you. The advice hasn't come through yet. Just one moment, please.
Chair, just while we're waiting for that, it does occur to me, in the future, as we move ahead with the ICS, etc., and the integration between the CCG and the PCC becomes even closer, perhaps the role of the HOS will be to question whether that group have made the right decision or not. So rather than referring to the Health and Wellbeing Board, we'll be checking whether they're doing it right or not.
Good point. Good point. Yeah.
Okay. Thank you, Philip. I think we've got enough on our plate.
Chair, I've just put some suggested wording into the chat. Would you like to have, you and Councillor Madden, the panel would like to have a quick look at that?
Yes. Could you
like to read out?
I'm not sure Councillor Madden can see his chat though, unless you want to read it out, Jane.
I can do, yes. Oh, sorry, Councillor Madden, I forgot.
Yeah.
Okay, so it's whilst recognising the Health and Wellbeing Board is providing strategic leadership and not about individual matters, officers be asked to establish whether it is in the Health and Wellbeing Board's remit to refer the matter to the Health and Wellbeing Board, subject to legal advice, and if so, to refer it. Refer it accordingly.
Right. Does that help Councillor Madden out at all?
Yes and no.
I knew you would say that.
It's clear. It's obviously written by at least three members. No, let me read my name.
Should we hear Councillor Madden's panel chair? But should we hear Councillor Madden's proposal first of all?
It's a serious situation. Yeah, but it's actually so good. The other thing
I want to give you a line out of our terms of reference. And they are to review and scrutinise all matters to facilitate the conduct of health review and scrutiny in consultation with local NHS bodies, also, which is South East Hampshire, also Portsmouth Health and Wellbeing Board and Local Health Watch. That's in our terms of reference.
Okay.
Any good for you, Councillor Madden?
Yeah, that's fine. What I want to say. Could I also? I need to confirm also when we do let me just preamble a bit. When we do a recommendation to send something to government and ask the chief exec to do it, that's what we do. We ask. We can't instruct the party, the chief exec. Can we? And so I presume on the same basis we could ask the CCG to do whatever I'm recommending rather than instruct them. Would that be correct?
Jane?
Yes, you would be asking them.
Yeah.
Sorry about all this.
That's all right, Councillor. I want to get it right for you, and I want to get it right for everybody, so we all know where we are.
Okay. Well, we ask that this panel asks the CCG to pledge to work with patient participation groups and others, including the Health and Wellbeing Board, just put it in there, to secure alternative provision as soon as possible from the current surgery. That's more or less the question the other day. And then I would add, and to report back to HOSP prior to September 21.
Members, Jane, you've heard that. Do we need to?
I'll send it to you. We agree.
Do you want to send it?
Sorry, what I said, whatever terms, if we agree and whatever terms they are, I'll email them to Jane.
Thank you.
Okay, Jane. Jane, have you got what Councillor Madden's just said there?
Yes. I think so.
Do members, do you want me to read it, ask Jane to read it out again, or are you happy for us to take the vote on that, the proposal? Shall we? Okay, Jane, do you want to just quickly read that out again? This is what we're voting on, members, just so we've got it correctly. I know there's some faces looking at me, but we need to get it right so everybody knows. I'm used to this in planning. So, Jane, could you read it out?
Okay.
It's proposed by Councillor Leo Madden, seconded, as far as I'm aware, unless he says anything different to Arthur. If that's okay, Arthur, I go. Over to you, Jane.
Okay, and Councillor Madden, just tell me if I've
If
this isn't correct.
Yes. Just read that again.
Sure. The panel asks the CCG to pledge to work with the patient participation groups and others, including the Health and Wellbeing Board, to provide alternative provision as soon as possible to the current surgery and report back to the HOS prior to September 2021. Councillor Madden, would you like to just check that wording there, just before?
I just picked the good wording from the question the other day, and it was to secure alternative accommodation.
To secure alternative provision. Sorry, I couldn't read my writing.
Okay, is that okay, members? Everybody happy with that? We don't think we need to read that out again. Everybody happy with that? That's what we're voting.
Can I say two things, please, Chair?
Sorry, yes, Councillor.
I think that Leo had stuck in specifically Health and Welfare Board as well into the thing which Jane didn't read out. Right. But the second point I would make, and I'm not suggesting one way or the other, I just want this all to be crystal clear.
Yes.
This is an acknowledgement and acceptance that the decision has been made, and this is focusing solely on consultation and alternatives. Is that what Leo means?
Leo?
Well, yes and no, in the sense that we've been told it's going to happen, but I think if I was part of the participation group, I'd want to dig a bit further into whether there's a possibility of it not happening. And in that case, then it's looking for this. A lot of it's been outlined by the CCG group. I mean, I appreciate they've looked into this in more detail, but nevertheless, we're getting lots of complaints as councillors about it. So yes, I had included Health and Wellbeing Board. You're right, but it's not an acceptance at this stage that it's going to close.
So with that, and a couple of people throwing a few things in, I'm sorry, Jane, do we need to read it again, or are members happy to take the vote on that? No one's telling me anything different.
Can you read it again? Read it again, please.
Yes.
Yep.
Okay. Jane, sorry, would you read it again?
Yes, of course. The panel asks the CCG to pledge to work with patient participation groups and others, including the Health and Wellbeing Board, to secure alternative provision as soon as possible to the current surgery and to report back to the HOSP prior to September 2021. Are there any amendments to that?
Any amendments to that, members?
Yeah, sorry, I'll have to. Right.
Okay, carry on.
Well, no, and it's in relation to the point that Peter has just been made, that in the event of the CCG confirming that they are going to close the Guildhall Walk GP and the bit after that, they may be persuaded, Joe, I know it's a difficult one, to change their minds for various reasons. When they're going into the deal, we don't know the rent provisions, we don't know the state of the building type thing. We're told that that's the sort of questions I'd be trying to get answers to if I was there as a consultee. Did you get that, Jane? Because I forgot what I said.
You said in the event that the CCG confirms the closure of the Guildhall Walk Healthcare Centre. But I wasn't sure where you wanted to put that. At the very beginning of the motion?
At the beginning.
At the very beginning.
That's okay, at the beginning.
You're sure?
Yeah.
I've got Councillor Vivian Outwell wanted to say something, sorry.
I don't know if we need to add in there to also work with the ward councillors or consult with them.
Yeah, well, I would assume that was a given. And the city council as well, in some form or other.
Not necessarily.
Well, I think they did. I was thinking it through, and I thought I'd end up with a list the length of my arm. I think that's the problem with it. You know, I mean, I think the participation group. If the CCG come back to us, say in July, whatever, we might whinge about the group. We think they didn't consult, but I think it's fairly wide remit in that sense. Though I don't know if we are the city council per se.
Okay. Sorry, going back to Jane again. If you got what
I have the wording, yes, and you did say, Councillor Madden, that you did put "and others," including the health and well. So you've got patient participatory groups, health and wellbeing board, and others. So I think that covers.
To say something. No. Okay.
So sorry, Chair. I did delete. I sent that by mistake. I wasn't sure.
That's all right.
I just wanted to clarify, and I don't know if it helps. So apologies. The decision to close again. We have to go back to the landlord and the fact that they are asking us to sign a new lease, which is significantly more expensive, given the quality and the state of repair of the building. So even if we were to re-procure, it's very likely that the practice wouldn't be in that building. And I think what we are attempting to do through the process is to secure that alternative provision for those patients through a number of different practices. We would be very happy to share that plan that's going to our committee next week with you, and to share the EIA and to work with the councillors, the practice, the patient participation group, and others that you saw fit to really make sure that we are supporting those vulnerable patients to ensure that they are able to take advantage of that choice that we feel we are offering them, and that they get that alternative provision. I don't know if that helps, Chair, and if it doesn't, I apologise, and I'll.
That's okay. We've got Councillor. Just missed it. Councillor. Someone's jumped in there. Councillor Archwell wanted to say something. Wanted to add something.
No.
Ian?
No, I didn't. No.
No, you didn't. Okay. What have I got here? Sorry, I've got councillors wanting other committee meetings at 4 o'clock. So I'm just very wary of the time, and obviously there's a vote to be taken here. So, Jane, have you got roughly what we're on about now?
Right. Yes, I can read out the motion if you'd like.
Right. If we can all be quiet and listen to the motion first of all.
Okay. Bear with me a second. Okay. In the event that the CCG confirms the closure of the Guildhall Walk Healthcare Centre, the panel asks the CCG to pledge to work with patient participatory groups and others, including the Health and Wellbeing Board, to secure alternative provision as soon as possible to the current surgery, and to report back to the HOSP prior to September 2021.
Right. Okay. Everybody happy with that? Councillor Madden, Councillor Arthur? Yeah?
Yeah.
Everyone happy? Okay then. So I'm just going to quickly read through people's names. If they just say yes or no, that's what's on the table. Councillor Lee Mason, are you for or against that?
For Chairman.
You were just about to say Lord Mayor then, weren't you?
Was.
Yeah. Councillor Leo Madden, are you for or against?
I'm for that.
Thank you very much. Councillor Steve Weems, for or against?
For, Chairman.
Thank you very much. Councillor Vivian Arkwell, are you for or against? Lovely. Arthur Argate, is he with us? Yes.
Yes,
yes, of course he seconded. David Keith had to go, so I do apologise for him. Philip Raffaelli, there we are.
For.
Thank you very much. Rosie Rains, Councillor Rosie Rains.
Thank you, Chair. For.
Thank you very much. And there's only myself, I think, and I'm certainly for that as well. So I think it's unanimous without doing that. Councillor Graham Heaney, are you entitled to a vote or not?
I hope so.
So, have we got you on my list? Of course, yes. Are you for or against that, Councillor?
I'm for.
Thank you very much, Councillor. There we are. So that's all unanimous, everybody. I think I don't think I've missed anybody out. Thank you for that, Joe. Thank you for answering that, and members. I know it was very, very heated, but we got there in the end. So is that okay for you, Jane, to take that forward?
Yes, Chair, that's fine. Thank you.
That's absolutely fine. And I know that Councillor Lee Mason had to go, and he sends his apologies. Councillor Mason, do you just want to say goodbye to us before we next move on?
Yes, thank you very much, Chairman. Just apologies, I'm leaving. I didn't think the meeting would have lasted quite this long when I was scheduling. Thank you for being able to work with you as Vice Chairman this year, Councillor Fuller. It's been a pleasure, and I wish you every success for your future, and I really hope to see you back with us again soon. So,
thank you very much.
I didn't want to sort of just slip out without saying giving you my best regards.
Thank you very much, Mason, Councillor Lee Mason. Thank you for stepping in as well on a few times as well. Great, and great to see you. I'm sure we'll see you around for a pint one day. Thank you very much. Enjoy your next meeting. Okay then. Okay, members. I think we're number 7 now. We're almost there. It's on the public health update, and members have read the reports and this item. Helen Atkinson, would you please introduce yourself, and if you'd like to say anything, and then we'll move on to any questions. Good afternoon, Helen.
Good afternoon, Councillor Fuller. So I'm Helen Atkinson, and I'm the Director of Public Health for Portsmouth, and I haven't got anything additionally to add to the papers.
Very good. Thank you very much. Very quickly, that one. Members, let's just see if the members will be as quick. Members, there we are. You've seen the report. Who would like to ask something to Helen at all there? Must be somebody, surely. Councillor Leo Madden, I know your thing isn't working. Would you like to ask Helen anything at all?
Oh, I thought it covered everything. Thank you.
All right. Okay, fine. Any other members want to say anything? Well, there we are. I'm sorry, Helen. It looks as though nobody wants to talk to you, I'm afraid.
That's quite all right. I really don't mind.
I must say, as Councillor Leo Madden said, a very detailed report. So thank you so much for that, and wish you best wishes to yourself and everybody. Thank you very much again for coming along. Sorry it was brief.
That's absolutely fine.
Thank you. Members, we now move on to number 8, which is Portsmouth Dental Data Update. No officer is available to present this paper, so the panel has been asked to send any questions, please, panel. If you've got any questions to the NHS England to respond after this meeting, which I think is just about to finish now. Okay, members, thank you. Anybody want to ask anything else on the meeting before I close it?
Yes, Chairman.
Yes.
I did pass it through to the office. In our last set of meetings, we had a report from the NHS Trust that told us that a review is underway to understand the number of people who are directed from the CAS to an alternative service rather than the emergency department, and the impact on GPS's general workload. I was just wondering when we were going to get a report on that review.
Thank you very much, Councillor. Jane, can you answer that at all, Jane, for the next meeting?
Yes, Chair. I put that question to the representative at the Portsmouth Hospitals Trust and asked that it be answered today. I will chase this up.
There we are. Thank you very much. Councillor Steve Weems.
Thank you, Chairman. Nothing significant, really. I just wanted to say goodbye and farewell. Wish you all well for the future. Likely to be my last council meeting, I think, today. It's been a long time on the council. I've quite enjoyed the hospital, to be honest. But I thought it'd be appropriate to say farewell. So long, and thanks for all the fish, as they say.
Thank you, Councillor. I think I can speak for everybody here. Hopefully, I can, and just say to you, thank you very much for all your for what for what you've done and for what you've said and your contribution to this. I know that a lot of people have always said, how much commitment and you put into it. So thank you very much over the number of years, and hopefully I may see you around for a pint one day, Councillor.
You never know.
You never know. Thank you for your contribution. Any other members want to say anything else before I officially say? Councillor Leo Madden?
Yeah, I just want to thank you, Chair, for the short time that you've been in, Chair. You've handled it very well. No, I have to say, I haven't been at any other meetings, I think, or in any other committees that you've chaired, so well done on that. And I'd also like to pass on my thanks to your good self and to Steve as well. We go back too long, I think, Steve, to
We
for this.
I
I think of Dewsbury, that's right, yeah. And also, although he's not here today, Tom Wood, who also won't be seeking re-election Chair, so I don't know if that could be minuted.
Yes, of course. Arthur, did you want to say something?
Yeah, I did. I just wanted to point out to Leo that he's still as good looking as he was when I first met him many years ago, and so am I.
Well, there we are.
It's a cardboard cutout, you see.
That explains his coloured glasses, though, doesn't it?
Yeah.
He does well. So, members, as I say, on behalf,
thank
you very much.
Yeah.
Thank you. As I say, I've thoroughly enjoyed myself on this. It's been a bit challenging today, but hopefully I've got the name semi-correctly. Who knows? I may be back again. Who knows? But can I wish everybody, if you are standing, best wishes and best of luck. Councillors, can I thank you for all your support as well, and obviously the support from Jane and her team as always. I will certainly miss you, Jane. So that's one thing, and I wish everybody a very happy and restful evening tonight, and thank you all so much for everything. God bless. Take care. Thank you.
Chair. I will live streaming. One moment.
Bye bye.
Enjoy your time.
Thank you. Bye bye. Bye bye.
Where's the off button? See you later, Rosie.
Arthur.